So the participants have 5 plus 1 minute for the presentation. After 5 minutes, you will be given a warming sign, and there you have to try to conclude your session in 1 minute. Please try not to exceed your session, not to exceed your presentation more than 6 minutes. So let me invite our first presenter, Diksha Kanta. She is going to present on Ayurveda for longevity, rejuvenation, and health promotion.
A very good morning to all of you. Myself, Dr. Diksha Kitna from DAV Jalandhar. I'm presenting on the topic Ayurveda for longevity, rejuvenation and health promotion. We are all aware of the ongoing health patterns. According to recent reports in September 2023 by WHO, we have seen increasing incidences of non-communicable diseases like cardiovascular, obesity, respiratory cancer. Due to which we have seen global rise in trends of self-care, and anti-aging market has flourished to the extent that we are expecting it to grow to about 120 billion US dollars by 2032 at the growth rate of 5.8%. I have referred various classical and modern textbooks, internet sources like Scopus, Web of Science, ResearchGate, health magazines and newspapers. What can Ayurveda contribute to the rejuvenating trends? In Ayurveda, we have vast data about the personalized medicine according to various permutations and combinations of Mansik and Sharirik Prakriti. Stem cell therapy can be conjunct with the Rasayana therapy. Mind and body interventions like yoga, meditation, pranayam can be intervened. Senolytic therapy can be collaborated with panchakarma and detoxification, which removes the toxin that stimulate or age the cells. Various Ayurvedic herbs like ashwagandha, gugul, ginseng has proven to balance the hormones like cortisol, thyroid, and adrenal hormones. And turmeric and neem are proven to rejuvenate skin, hair. Iogenomics play a crucial role in this as it influences the gene expression. There is a study in BHU Varanasi along with the Portugal University. They studied various Ayurvedic drugs and which proven to enhance the mitochondrial function and lengthen the telomere, which is the endmost part of the chromosome. More the telomere lengthens, more it reverses the aging or slows the process down. Through these years, through ancient times, Ayurveda drugs have proven to having various potential health benefits like Haritaki being purgative, purification, and Google proven to for joint and immuno care, Nagamusta having hepatoprotective property, Shatavari being rejuvenator, purifies the blood, Karvela containing bovine insulin, Yashti Madhu as immunobooster, anti-mutagen, Jatamansi effective for mental health, Pipali enhances the absorption, Kapikachu for nervous system, and Pashan Bhed supports the urinary bladder by acting on calcium and crystalloid colon balance. According to CCRS publication 2019, mode of action of Rasayana can be seen as it acts on Rasa, nutrient value of plasma, Agni, digestion and metabolism, Srotas, microcirculation and bioavailability, which in turn improve the quality and nourishment of the tissues, resulting in longevity, Jaranash, immunity, Vyadhinash, mental competence, Medha, Vriddhi. We have various Ayurvedic inputs in relation to age and body systems of human. Sharangdar has given decade-wise qualities which we lose during our aging process, and he has given also various rasayanas which can be intervened in various decades of the life. For example, Shira, Grit, Gambhari in the starting phase, and Bala and Sehachar in the last decade, and Brahmi, Shankha Pushpi in the middle age. We are all aware with the Rasayana Falashruti, Dirgham Ayush Smriti Medha, Arogyam Tarunam Vaya, Prabhavarna Swarodaram, Dehendriya Balam Param, Vagasiddhi Pranati Kanti, Labate na Rasayana, Labho Payohishastanam, Rasadinam Rasayana. These are all the attributes which are needed in which are desirable in today's generation, like longevity, memory, utmost excellence in the qualities of body tissues. Various Ayurveda-inspired rejuvenation programs, products and services can be introduced and investigated and developed in integration with the modern rejuvenation and anti-aging protocols. Thus, we can conclude that Ayurveda offers a holistic approach to longevity, providing significant increase in telomere length and decrease in oxidative stress and inflammatory markers. We can integrate these principles into modern healthcare to promote healthy aging. Thank you.
Thank you, Diksha. The next presentation is by Dr. Divyani Singh on antioxidant activity and quantification of gallic acid and curcuminoids in Haridra Khanda.
Good morning, one and all. Present here, myself Divyani Singh, Department of Rasastra and Bhaisajya Kalpana, All India Institute of Ayurveda, New Delhi. My topic is evaluation of antioxidant activity and quantification of curcuminoid and gallic acid in Haridra Khand, insight for immunomodulatory action. Introduction. Haridra is a classical Ayurvedic formulation which is mentioned in classical Ayurvedic text Bhaisaj Ratnavali. It is widely used for treating conditions such as Sheetpit, Kandu, Dadru and other allergic skin disorders. Each ingredient in Haridra Khand has been scientifically validated for its therapeutic efficacy. Gallic acid and curcuminoids, known for their immunomodulatory effects, are key component of this formulation. Gallic acid and curcuminoid are phenolic compounds. Intake of herbal product that are rich in phenolic compounds which have antioxidant properties can decrease the likelihood of developing disease and help prevent degenerative disorders. Objective of my studies are to find antioxidant potential of Haridra Khand and by DPPH method, and quantification of its active constituent gallic acid and curcuminoid by HPTLC, high performance cellular chromatography. These are some common pharmacological activity of curcuminoid and gallic acid. Material and method. Haridra Khand was prepared in Bhaisajya Kalpana lab at All India Institute of Ayurveda. Antioxidant activity was done by DPPH method by UV spectrophotometer, and quantification of curcuminoid and gallic acid was with the help of high performance cellular chromatography. In DPPH antioxidant method, ascorbic acid, 10 mg of standard ascorbic acid was dissolved in 10 ml of methanol. 0.5 millimolar of DPPH was prepared in methanol. 0.1 gram of powder sample of Haridra Khand was dissolved in methanol. And in analysis, ascorbic acid and Haridra Khand solution were individually treated at varying concentration with DPPH free radical solution. And after 30 minutes, absorbance was measured at 517 nanometer. IC50 value was then calculated using different concentration of standard and sample to find total radical scavenging activity. Here are the result of antioxidant activity of Hardrakhand with reference to standard ascorbic acid. Where IC50 value of ascorbic acid was 24.47 microgram per ml, which is very strong antioxidant, which shows very strong antioxidant activity. And in Haridrakhand, IC50 value was 128.64 microgram per ml, which shows an average antioxidant activity. This slide shows the methodology adopted for quantification of active constituent curcuminide and gallic acid by HPTLC. These are the results shown in figure. Quantification of curcuminide by HPTLC, where the RF value was observed for standard and sample was same, and the result was 260 microgram curcuminide found in 100 mg of Haridrakhand. And the quantification of gallic acid, a result shows RF values shows similar, and the result was observed 107.2 microgram in 100 mg Haridrakhand. Discussion. The substantial quantity of curcuminide and gallic acid in Haridrakhand highlight its pharmacological significance given the diverse therapeutic properties associated with these compounds, including antioxidant, anti-inflammatory, and antimicrobial effect. The notable antioxidant activity suggests a strong capacity to neutralize free radicals, which is crucial in mitigating oxidative stress associated with allergic responses. All these findings reflects upon its immunomodulatory action. Conclusion. The analysis of Haridrakhand confirmed the presence of bioactive constituents that contribute to its therapeutic efficacy in various ailments-wise skin disorders and other allergic conditions. The antioxidant potential and the immunomodulatory effect of its active constituent indicate that Haridrakhand may enhance immune response in different conditions. Future research should explore the synergistic effect of the various ingredients, optimize extraction method, and total antioxidant activity to eliminate the formulations of full therapeutic potential. These are the references. Thank you so much.
Thank you, Dr. Divyani. Now let's invite Dr. Priyanka Taneja.
A very good morning to dignitaries present off and on the dais, faculty members and the guests present here. Myself, Dr. Priyanka Taneja from Kriya Shari Department, All India Institute of Ayurveda, standing here to present my paper entitled Effect of Sot Mriduvika, Raisins on Pollution-Induced Fatigue, a pilot study in Delhi, NCR. Indian medical text has mentioned a plant called Mriduvika, raisins in their various compositions and under various categories. It is particularly helpful in balancing the body's Vata and Pitta doshas. Mriduvika is also a natural laxative and can help relieve fatigue and tiredness. The different acharyas have mentioned Mriduvika under different categories, among which Acharya Charak has mentioned in Shramhar Mahakashai. Some insights about Mriduvika. It is categorized in Plantae kingdom, order Vitellius, family Vitaceae, genus Vitis, and discovered by Lynn, Latin name Vitis vinifera, Hindi Angur, Drak, Munakka, English name grapes, raisins, Sanskrit name Mriduvika, Swadufal, Madhurasa and Gostani. Its ras is Madhur, Gun is Guru Snigdh, Viryashit, Vipak Madhur. In Charak Sutra 27, Shlok 3, Mriduvika is mentioned as Brihani. And by Kedev Nighantu in Aushadvarg, it is mentioned as Brihani, Vishya, Vatpidagni and Pushtikar. Air pollution occurs when harmful substances like dust, fumes, gas, mist, odor, smoke or vapor when inhaled can negatively affect the human health and cause inflammation, oxidative stress and weakened immune system. Inflammation in body can contribute to feeling of fatigue, emotional distress, anxiety, depression in different individuals of ages of both immediately and over the time. Ancient objective aim is to explore the potential of soaked Mriduvika on pollution-induced fatigue levels in healthy individuals of Delhi NCR. Primary objective was to investigate the efficacy of soaked Mriduvika in mitigating fatigue induced by air pollution among the individuals residing in Delhi NCR region. Secondary objective was to evaluate the subjective experience of fatigue among the participants before and after consuming the Mriduvika, to gather the preliminary data to inform the design of larger scale studies on potential benefits of Mriduvika for pollution-induced fatigue. Research question was, does the consumption of soaked Mriduvika have a significant impact on alleviating fatigue induced by air pollution exposure in individuals residing in Delhi NCR region? Hypothesis. Null hypothesis was there was no significant difference in fatigue levels of individual who consumed soaked Mriduvika while exposure to polluted air in Delhi NCR, and alternative hypothesis was vice versa. Methods and material. Method was, firstly, the participants were identified for enrollment. Those fulfilled the criteria when the AQI in Delhi NCR was 300 and above. Enrollment of participants were done after the consent. Baseline fatigue assessment parameters was assessed and using the dedicated scale along with the subjective parameters. Intervention was given for 4-week period. Post-intervention assessment was done by the scale and the subjective parameters. Material, it is a single-arm pilot study which was conducted for 4 weeks in the south zone of Delhi NCR. 30 participants were recruited who experienced fatigue during the pollution exposure for at least 1 month. Intervention was participants were instructed to consume soaked Mriduvika prepared by soaking 20 grams of resin in 200 ml of water overnight every morning on an empty stomach, where Mriduvika was provided to the participants for 4 weeks. Outcomes. Fatigue level were assessed using fatigue assessment scale and basic subjective parameters at baseline and post-intervention. Data analysis, descriptive statistics will be calculated to summarize the baseline and endline characteristic of participants. Ethical consideration, the study will adhere to ethical guidelines including obtaining informed consent, participants, ensuring confidentiality and minimizing any potential risk associated with intervention. Observation, the scale was a 10-question questionnaire in which pre and post questionnaires were filled by the participants. As we can see in the graph, a major reduction in mental and physical fatigue was seen where the people pre-intervention experienced 84% of mental fatigue, which reduced to 45%, and physical 77% was reduced to 46%. A decrease in standard deviation was observed from 1.30 to 1.02, indicating a decrease in variability, and thus treatment was more consistent in its effects. Results, the study demonstrated a significant reduction in fatigue among the participants who consumed soaked Mriduvika every morning. As measured by the fatigue assessment scale, the mean score decreased from 3.02 at baseline to 2.25 post-intervention, which is 25% decrease, indicating a substantial improvement in fatigue level and positive impact. Of the 10 performance metrics evaluated, 6 demonstrated a notable improvement. The most significant gains were observed in mental and physical fatigue. Apart from quantitative findings, subjective improvements were also seen in the participants. Discussion, Mriduvika is considered as rasayan, which means it is rejuvenating and promote overall health. It is believed to possess the properties that can balance 3 doshas. Air pollution aggravates vata and pitta dosha. Result suggests that incorporating Mriduvika into daily diet habits may be a promising approach to elevate fatigue. Probable mode of action, it balances vata dosh, provide essential nutrients, acting as antioxidants and regulating the blood sugar level. Shortcomings, the Mriduvika, further research needed to confirm the efficacy of Mriduvika in pollution-induced fatigue to explore the optimal dosage and duration of consumption. Large-scale studies are needed. Future scope, we need to identify the mechanism for this. Conclusion, Amritam hi Mriduvika rasayanam sharinam poshyati balam vahati, and it is a wonderful way to boost one's mood and energy. Thank you.
Actually, we have beautiful papers being presented. Actually, a lot of discussion can also happen. Unfortunately, we have very much and narrow time schedules. Maybe first the paper presenters will finish, and if we have some time, we may open up a discussion later on. And we have some guests, international guests also. I see Dr. Christian and Bera. Maybe they can come forward and occupy the front seats, if they wish so. Thank you.
Now let's invite Dr. Vinita Singh for our presentation.
A very good morning to the respected chairperson and delegates. Myself, Dr. Vinita Singh, PhD scholar in the Department of Sanskrit and Yoga, Faculty of Ayurveda, IMS, BHU. I am going to present my topic, gut microbiota in Agni, in relation to the elderly health, a new frontier for elucidating aging, under the guidance of Dr. Mangala Gauri V. Rao ma'am, Associate Professor and the head of the department. Now the introduction, as we know, as the Ayurveda has given the importance to the Agni, which is responsible for the transformation of the food into the energy, nutrient, the waste product. In modern science, there is a concept of the gut microbiota, which include the trillions of the microorganisms, including the bacteria, viruses, and protozoa, which is responsible for the digestion, metabolism, and the immune function of the body. In old age, there is a decline in the gut microbiota and also the strength of Agni. So the changes in the gut microbiota is responsible for the changes, responsible for the inflammatory changes in the body, cognitive decline, and also the weakness in the body. Methodology, detailed information has been gathered from the various literature of the Ayurveda text and also from the different published paper in the database journal, including the with the help of the Boolean operators and not a paper was selected with the keywords human gut microbiome, gut microbiota aging and gut microbiota, etc. Now the concept of the Agni, the main function of the Agni is the body is to digest and metabolize the various components of the food, which is responsible for the complexion, strength and life, nourishment and the luster or stages. Charak has stated in the Chikitsa Sthan 15 chapter, if the function of the Agni is stopped, there is the death of the individual. If the function of the Agni is vitiated, it will lead to the various kind of the disorder and diseases. If the function of the Agni is in Samavastha, it will lead to the longevity and the healthier life. We have also seen that according to the Ritu, there is also decline in the function of the Agni. But same in the old age, automatically the other function of the Agni lead to the alter the very disease condition. Most common problem which we have seen in the old age is the Asthi. So here is the role of the Jatra Agni, Bhuta Agni and Dhatu Agni in the Asthi. The vitiation of the Dhatu Agni lead to the improper digestion, ultimately lead the formation of arm, which is responsible for the various kind of the diseases. The dearrangement of Bhuta Agni, especially the Parthiv Agni, Vayu Agni, affect the conversion of the heterologous Panch Bhautik Dravyas to the homologous Panch Bhautik Dravya, which lead to the nutritional deficiency resulting in the Asthi. Similarly, the Dhatu Agni, chief function of the Agni is the metabolism, is comprised of the anabolism and catabolism. Hyper and hyper function ultimately leads to the Asthi or Vriddhi of the Asthi Dhatu. Hence, the function which causes the hypofunctioning of the Jatra Agni also causes the hypofunctioning of the Asthi Dhatu Agni and result in the improper conversion of the Poshak Asthi Dhatu into Sthai Asthi Dhatu, leading to the Asthi. Here are the few functions of the gut microbiota. Gut microbiota break down the complex carbohydrate into the short chain fatty acid, which ultimately help in the intestinal lining. It also boosts the immune system, protect against the various autoimmune diseases, regulate the metabolism of the fat, maintain the glucose level, and also helpful in the synthesis of the vitamin B12 and the K. Also, it function to communicate with the brain, influencing the mood, stress response, and the cognitive function of the gut-brain axis. A relationship between the Agni and the gut microbiota, decline of the Agni and the gut microbiota diversity in elderly is associated with the reduced digestive efficiency, increase the inflammatory condition in the body, and higher the risk of the chronic disease. Both the Ayurveda and the modern science emphasize the importance of maintaining the healthy digestive system to promote the longevity and the well-being. Here are the few functions of the relationship between the gut microbiota and Agni. Both are helpful in the detoxification of the body. If the gut microbiota function very well, it detoxifies the harmful substances like the xenobiotics from the body, maintaining the digestion and metabolism of the body, also helpful in the function of the immune system. The therapeutic approach to enhance the gut and the healthy gut health and the Agni in the healthy. There is a dietary recommendation in the Ayurveda for the elderly. It was advised to the diet warm and nourishing food for the elderly person, including some spices, ginger and cumin. Also in the modern science, there is the concept of the prebiotic and probiotic, which maintain the gut microbiota. If you see the lifestyle modification, Ayurveda recommended the daily practice of the daily physical active vyam, adequate rest, nidra, abhyanga, to subside the vata dosha. In the modern papers, there already published research that during the regular practice of the exercises makes the gut microbiota healthy, especially the lactobacillus and bifidum. These are the mode of the action of the rasayana, which are active on the 3 level. Mechanism of action of the rasayana on the basis of the modern science, it decline the oxidative stress, inflammation, to contingent lipid peroxidation, antioxidant enzyme enhance. Discussion is mainly the ashwagandha, which is act as a rasayana, influence the HPA axis, also act as the anti-inflammatory, anti-rheumatic, anti-arthritic, hence helpful in the painful condition. Trifla modulate the gut microbiota, especially the bifidobacteria and lactobacillus, which increase the growth of the undesirable gut microbiome. Conclusion is a well-structured daily regimen, balanced diet, regular physical activity can modulate, improve the digestion, enhance the immune function, support the cognitive function, and promote the overall well-being in elderly. Further research is needed to explore the scientific mechanism with the Ayurvedic practices, influences the gut microbiota, and to validate the thorough clinical study. These are the references. One is the messages. As we know that the aging is an inevitable process, but it is in our hand to maintain control in direction. Thank you.
Thank you, Dr. Vinita. Now, Rohit Johari, you may come for the presentation.
सभी गुरुजनों को प्रणाम। मैं डॉक्टर रोहित जौहरी, दयानंद आयुर्वेदिक कॉलेज जलंधर का एसोसिएट प्रोफेसर द्रव्य गुण हूँ। आज का टॉपिक है हमारा द स्कोप एंड अपडेट्स ऑन मिलेट्स एंड न्यूट्रास्यूटिकल्स। इट इज़ अ स्टडी ऑफ इंटीग्रेटिंग आयुर्वेदा विथ मॉडर्न फंक्शनल फूड्स. Introduction. Diet, Ahar, is the key pillar of health in Ayurveda and modern medicine. Millets, those are included in Ayurveda as Shudra Dhanya, are emphasized in Ayurvedic texts for their health benefits. Modern advancements in nutraceuticals highlight their potential as a functional food. This study explores the convergence between the Ayurvedic knowledge and modern nutraceuticals. Why millets are included in the study? Because of global recognition, and the last year 2023 we observed the International Year of Millets as directed by United Nations. Moreover, the health benefits of millets is, that rich in fiber, protein and essential minerals also gained attention. Moreover, it supports the gut health of the human health, blood sugar management, weight control. Regarding modern application, functional foods, gluten-free products, nutraceutical formulations, millets in managing chronic diseases such as diabetes, CVD conditions, its sustainability in the environment, drought-resistant crop, low environment footprint, enhances the food security. The market potential is very important. Millet-based snacks, beverages and flours are in demand. Not only in India but also in European countries, growing interest from health conscious consumers. The material methods included literary review, which includes Ayurvedic classics. And secondly, dietary analysis, selected millets categorized by 3 dosha type, nutritional components like macronutrients and bioactive compounds, nutraceutical comparisons, active compounds like adaptogens, antioxidants and prebiotics. Nutritional profiling of millets includes the 4 millets: foxtail millet, finger millet, banyan millet and kodo millet. The macronutrient composition includes the rich in carbohydrate, proteins and fats. These millets are rich in carbohydrates, proteins and fats. Moreover, essential vitamins, minerals and bioactive compounds are seen in these millets. These are the observational nutritional values of selected millets per 100 grams. Foxtail millet, we see the 351 energy. Moreover, four millets have shown more than 300 kilocal of energy per 100 grams. Carbohydrates, we see the ratio, and you see the graph in this that finger millet, that is ragi, is rich in iron content 3.9. Banyan millet is rich in iron content by 15.2. This is the observational nutritional values of selected millets. Later, the convergence of Ayurveda and nutraceuticals. Foxtail millet balances Vata and Pitta. The active components present are magnesium and polyphenols. Nutraceutical compositions are magnesium, supplements and antioxidants. The health benefits are cardiovascular health and antioxidant support. Finger millet balances Pitta and Kapha. Calcium and saponins are the active components. Calcium supplements are enriched. It supports bone health, antioxidant properties. Banyan millet balances Vata. Iron, polysterols are the active components. Iron supplements and prebiotics are enriched. As a nutritional comparison, health benefits includes anemia prevention and digestive health. Kodo millet balances Kapha. It is rich in active components like tannins and polyphenols. Nutraceutical comparison includes antioxidants and anti-inflammatory effect. Health benefits includes anti-diabetic and anti-inflammatory effects. This table highlights the comparison of traditional millets and selected modern nutraceuticals in terms of their active components and their health benefits. Now coming to the result, nutritional comparison of millets. This graph illustrates the carbohydrate, protein and fat content of 4 millets per 100 gram. It helps highlight the macronutrient distribution across these millets. Lastly, the convergence of traditional millets and nutraceuticals. This graph shows amounts of key bioactive compounds like magnesium, calcium and iron. In the selected millets, it illustrates how these natural grains compare to modern nutraceutical components in terms of essential minerals. Alignment, you see in the graph, they are good source of calcium, magnesium and potassium, manganese, phosphorus and irons. Lastly, let us discuss daily inclusion of millet supports our health. Ayurveda emphasized individual diet-based dosha, synergy between traditional and modern approaches to health. Combining these millets with nutraceutical may approach holistic approach. Lastly, millets are the nutrient dense and aligned with Ayurvedic principles. Modern nutraceuticals often trace their origins to Ayurvedic formulations. Integrating millets with nutraceuticals can enhance preventive health care. And lastly, further research is required to validate findings and explore global applications. Thank you.
Thank you, sir. Now let's invite Dr. Reshmi Babu.
Om Dhanvantare Nama. Good morning to all the respected personalities present here. Myself, Dr. Reshmi Babu, would like to present on a topic, drug repurposing, a future trend in Ayurveda with special reference to Vardhamana Vipali Rasayana. Drug repurposing is a strategy of finding a new uses for already existing drugs, as it is started on 1980s and came into trend on 2004. As traditional drug discovery and development involves several stages for a discovery of new drug, and it will be very expensive, and for marketing approval of such drug by Drug License Authority, Drug Policy Section, Central Drug Standard Control Organization, Quality Control of India will take a long while. In this condition, drug repurposing has gained attention of finding new therapeutic uses for already available drugs. As These concept of drug repurposing has recently started in contemporary science for finding new indication for already existing drugs, and which was practiced in Ayurveda since centuries, because we in Ayurveda consider dosha haratva than roga haratva as the basis of treatment. So here is a attempt to repurpose Vardhamana Pippali Rasayana, which is Vata Pitta Rasayana, and which is mainly indicated in Prameha, Pliharoga, Shwasa, Kasa, Hikka, Yakshma, Arsha, Galagraha, Uttara, Shosha, etc. in classics. So, material and methods which are used for these studies were taken from the GS Ayurveda Medical College and Hospital, and subjects of hypothyroidism, fatty liver and diabetes mellitus have taken, and Vardhamana Pippali Rasayana is given in Madhyama Matra for 19 days with Shirahara after a course of Virechana Karma. And objective assessment was based on investigation before and after the treatment. So result which I've seen is before the Vardhamana Pippali Rasayana in thyroid profile, thyroid stimulating hormone was 9.38, and after the course of Vardhamana Pippali Rasayana, it reduced to 3.33, and there are significant changes were seen in T3 and T4 level also. Moving to the blood sugar level, where fasting blood sugar was 151 before the treatment, where HbA1c was 6.7, and after the course of Vardhamana Pippali Rasayana, it reduced to 111, that is fasting blood sugar. And during the ultrasound report, before the course of the treatment, we have seen that fatty liver grade 1 was there, and after the course of treatment, it was came as normal study. So by this we can say that practice of drug repurposing was already present in Ayurveda as a form of treatment on basis of dosha haratva and its relation to dhatus, where Vardhamana Pippali Rasayana, which is Tridosha Shamaka and having Tishna Ushna quality and having Shroto Shodhana effect and its affinity towards Rasa and Rakta Dhatu. The three cases which is mentioned above was all endocrinal conditions which are in Pitta Sthanas, where Vardhamana Pippali Rasayana is having an infinity or inhibitory action towards these glands, where we can say that Vardhamana Pippali Rasayana is a prime choice for Sandarpanottajanya Vikaras. Piperine, which is an active principle which is present in Pippali, is having an anti-inflammatory property, anti-hypertensive property, hepatoprotective property, neuroprotective, hypoglycemic, hypolipidemic property. Along with that, it inhibits T3 and T4 level also. It is also having immunomodulatory, anti-asthmatic property also. Shirohara or Shirodhana, which was given during the Vardhamana Pippali Rasayana course, was helped in reduction of weight also. So by this, I can conclude that Vardhamana Pippali Rasayana, which is the prime choice for Sandarpanottajanya Vikaras, and we can give in any Sandarpanottajanya Vikara also by considering dosha and dushya, where almost in Ayurveda all drugs are repurposed either as a whole or replacing one or two drugs. So we can say that this concept of drug repurposing has gained significant traction owing to its advantages such as cost effectiveness and shortened timeline for drug development. And we can say that this concept is indeed need of the hour and will become a future trend and can be an answer for raw drug unavailability, low resources and safety concerns. Thank you.
Thank you, Dr. Rashmi. Now let's invite Dr. Ishita.
Good afternoon, everybody. My name is Ishita. I'm a final year MBBS student, and today I'm going to present my study, Bridging the Gap in Ayurvedic Knowledge. The study evaluated Prakriti of 85 volunteers from Bharat Electronics Limited during a Yes to Yoga U workshop conducted by the Ishimani Foundation. The objective was to identify the doshas among the brains of the nation and examine the gap between their Ayurvedic education and also advocate the inclusion of Ayurveda from school. After taking written consent, the Prakriti assessment was conducted using a standardized Ayurvedic questionnaire, evaluating the physical and mental characteristics of individuals. Participants also answered questions on how Ayurveda had been incorporated into their daily lives and whether they had gained this knowledge through cultural practices or formal education. The data was then analyzed to establish correlations between an individual's Prakriti and understanding of their Ayurveda. It's not, excuse me, it's not working. Yeah, it's okay. Continuing with our topic, out of a total of 85 individuals, there was a majority between the 56 to 60 category with a male preponderance. And there was predominance of people who have medium resistance to disease. Physical activity status showed a moderately active category enhancement with people who have majority with medium memory, and the last graph depicts people predominantly having sleep in the range of 6 to 8 hours. 35% had a Vata constitution, which indicates qualities like dryness, irregularity, variability in their physical and mental attributes. 40% of participants were a Pitta constitution, which was characterized by heat, sharpness, intensity, etc. And 25% had a Kapha constitution, representing stability, heaviness, slowness, etc. Our studies show that individuals who had never taken an Ayurvedic consultation had a predominance over those who had taken them occasionally. And those who weren't satisfied with the consultation had majority over those who were satisfied. Ayurvedic knowledge had a significant gap between cultural and formal education, with 20% showing a comprehensive understanding of Ayurvedic principles, with knowledge of specific treatments like dosha system and how those could be applied for personalized healthcare. The remaining 80% of the participants had fragmented knowledge that was largely acquired informally through cultural transmission, such as family traditions or local practices. Their understanding lacked depth and precision, highlighting the absence of the need of formalized Ayurvedic education. Interestingly, when surveyed, 70% of the participants expressed a desire to learn more about Ayurveda, with 55% stating they would have appreciated exposure to this knowledge earlier in life through school curricula. This data revealed a clear statistical gap between Ayurvedic literacy of those who had received formal education and those who had not. The study concludes that the analysis of Prakriti provides a scientific understanding of physical and mental status of life, as shown before. Besides the mental aspect already mentioned previously, factors like memory, decision-making ability, and stress coping are enhanced by knowledge of Prakriti. While Ayurveda is deeply ingrained in the Indian culture, the structured transmission of this knowledge is minimal, and this needs the need of the hour is to bridge the gap between cultural knowledge and formal Ayurvedic education. Formalized education from an early age can play a crucial role in preserving and advancing Ayurvedic knowledge. To encourage recognition of Ayurveda from local to global recommendations, I again highlight local to global recommendations, are that the Ayurvedic principles should be applied from community of the modern society, that is from inter and intra systems. The integration of Ayurveda should be inculcated into the school curriculum, and public awareness campaigns should be conducted beyond culture practices. Further research is required for long-term health outcomes to gain more benefits from Ayurveda, especially to increase our longevity, which was well narrated by our honorable keynote speaker. So, to end this topic, let's not overlook the significance of our treasure by allowing it to lie in slumber, and instead, let's prevent it from fading into obscurity through actions, like depicted in the picture below. We do acknowledge the active participations of Bharat Electronics Limited. We are grateful to the Ishi Money Foundation who organized this survey, and to Dr. Rakhi Ayurvigyan who allowed us to conduct this study. We are extremely thankful to the respected chairman, co-chairperson, especially for her work on genomics, for my inspiration, and the organizers, Aroha Ayya, for giving us this opportunity to present our thoughtful study. And lastly, I'd like to thank everyone here for your patience and your attention. Thank you.
So I invite Dr. Ayushi Shiran for her presentation, Ayurveda for Longevity and Rejuvenation and Health Promotion.
Good morning, everyone. Myself Ayushi with my teammates Bharti and Lakshmi Priya, BMS UG student, second prof, are from Shivalik Institute of Ayurveda and Research, Dehradun, are hereby to represent a presentation on a topic Ayurveda for Longevity, Rejuvenation and Health Promotion under the guidance of Dr. Akansha Chauhan. Ayurveda is the science of life, is oldest system of medicine primarily developed with two basic objectives. Ayurveda prayojan cha asya swastasya swastha rakshanam aturasya vikar prashmam cha. Promotion of health and prevention of disease in a healthy individual, eradication of disease in the disease of individuals. Central to Ayurveda is the belief that each person has a unique prakriti and doshas, which is a combination of the elements of Panch Mahabhut, by balancing the doshas Vatpit Kaph, and the following principles like Tripstam, Vihar, Sadvrit, Dincharya, Ritucharya and Achar Rasayan, one can maintain health and prevent illness. The rejuvenation therapy is known as Rasayan for enhancing longevity, vitality and overall well-being. Rasayana aims to restore the body's natural balance, slow the aging process, and prevent disease. In recent years, the principles and practice of Ayurveda have gained global recognition, especially in integrative medicines. Key Ayurvedic practice for longevity. Ahar. Ahar is the main factor, emphasizing balancing dosha-specific diet, which is mentioned. Nitya Sevani Dravas are mentioned in Charak Sutristan and Ashtahar Vidhi Visheshan in Charak Vimanstan. Second one is the Dincharya. Following structured routine promotes a self-care through different daily activities. Third one is Ritucharya, adapting lifestyle habits according to seasonal changes to stay in harmony. Fourth one is meditation and yoga for mental rejuvenation and stress reduction, and Ashtang Yoga, which is mentioned in Patanjali Yoga Sutra. Rejuvenation therapies in Ayurveda. First is Panchkarma, detoxification therapies to eliminate toxin from the bodies. Vaman, which is for you, Shreshtu Chikitsa for Kapha. Virachan, which is for Pitta, and Basti for Vat. Nasya and Rakta Mokshan. Second one is rejuvenating herbs, that is Amalki, which is rich in vitamin C. Aspartic acid promotes cellularly rejuvenations. And second one is Ashwagandha, adaptogen that reduce stress and enhance vitality. Third one is Shatavari, enhances energy and vitality, especially in women, promoting health through Ayurveda. Ayurveda holistic health approach, preventive and promotive healthcare rather than just treating disease. Second one is Oj, the essence of vitality and immunity cultivated through proper lifestyle and nutrition. Third is Ayurvedic health promotion strategies. First is regular exercise, yoga and daily movement. Second is pranayam, breathing techniques for physical and mental balance. Third one is sleep hygiene, proper rest for rejuvenation is very important. And use of adaptogenic herbs for stress management. Ayurveda's approach to longevity and rejuvenation's main concept, Rasayan. Rasayan is the branch of Ayurveda which is aimed at rejuvenation, anti-aging and promoting long life, which refers to Charak Chikitsa. Key components are nourishing and enhancing body tissues, which is on Dhatus, strengthening the immune system, promoting overall physical and mental well-being. Why it matters today? It is very important. Modern lifestyle and stress have increased interest in Rasayan for health optimizing and longevity. Age-specific preventive Rasayan, which is mentioned in Sharangar Sahita Purvat, 1 to age Balya, Vacha, Swan Bhasam, and 21 to 30 for Amlaki, Loha Bhasam, age 51 to 60 Trifla, Shatavari and Jyotishpati, and 81 to 90 years for Brahmi and Shankpuspi. Contemporary terminologies used to study Rasayan was immunomodulators, antioxidants and adaptogenics, and tissue protections and regenerations. Antioxidants are Guduchi. Ashwagandha were found as antioxidants. Brahmi is known as Ayurvedic drug for memory enhancing, for sedative, also exhibiting anti-1 lipid peroxidative property. Adaptogen activity, Tulsi and Ashwagandha are reported to have adaptogenic activity also. Tissue promotion and regeneration was Amlaki. Immunomodulators are Guduchi. And improving immune system, turmeric, Amlaki and Bhume Amlaki and Katuki are used. Achar Rasayan, psychological aspect, social behavior and religious spiritual aspect. Conclusion. Ayurveda provides a time-tested holistic approach to health promotion and longevity. Integrating Ayurveda practice like Rasayan, a balanced diet and routine can lead to rejuvenation and overall well-being. In Ayurveda, health is more than absence of disease, is a dynamic state of balance and harmony. The greatest wealth is health. Thank you.
Thank you, Ayushi. Now let's invite Dr. Shilpa Walkikar ma'am for her presentation.
नहीं स्क्रॉल नहीं नेक्स्ट यस ठीक है ओके ओके थैंक यू गुड मॉर्निंग एवरीबडी Myself, Dr. Shilpa Shankara Walkekar. I am Associate Professor in Tibia College, and I am a PhD scholar in Swasthottar Department in AIIA. Today my topic of presentation is effect of Kunjal Kriya in respiratory system with special reference to lung capacity. It is a review article. Next, introduction. The Kunjal Kriya is also known as the Kunjal Kriya, Vaman Dhoti and Gajakarni as per the Hatha Yoga Pradipika and Gherand Samhita. It is the yogic therapeutic self-emesis, self-induced emesis, which is practiced to drink maximum of water. It approx 2 to 3 liters of lukewarm water with 5% salinity, and then expel it out. Next, it detoxifies our body. It is the detoxification procedure indirectly, which indirectly supports our better respiratory system by reducing the systemic inflammation and promoting the overall immunity. The physiological process of this procedure is after drinking that water, after drinking the 2 to 3 liters of lukewarm water, the practitioner should use the fingers. If he has not naturally get vomiting, then he can use the 2 fingers to stimulate the back of throat inside the mouth, which triggers the gag reflex and expels the water forcefully along with the mucus, bile and toxins in the stomach. During the expulsion, the muscles of stomach get contract, and pushing the water helps to stimulate the diaphragm and the respiratory muscles also. Hence, it clears the mucus from the upper respiratory tracts, so the path becomes, or airway tract becomes the clear. Hence, it enhances the oxygen intake. As oxygen intake enhances, it impacts on the lungs. Then it also parallelly activates the diaphragm, and this activation of diaphragm results into the improvement in breathing patterns. The basic anatomy of respiratory system here, I want to say how we inhale and exhale, just a basic image, and that last upper corner, it shows the gas exchange. How the alveoli are the smallest tiny structure of our pulmonary system, how it get to the pumping action of the alveoli, or they extract the pure air and they supply to the blood supply in the blood vessels. Next image. By this image, we can see that while inspiration, thoracic cavity expands, and as thoracic cavity expands, the external intercostal muscles get contract along with the diaphragm. Both get contracts parallelly. Next, during exhalation, thoracic cavity reduces. On the same side, as thoracic cavity reduces, diaphragm get relaxes and external intercostal muscles get relaxed. Then lung capacity. What is lung capacity? What is the lung volume? Are both they are same? Pulmonary functions, are these terms same? Yes, it is the somewhat same like that. Lung capacity, the definition of lung capacity is the total amount of air in the lung which we can hold, human being can hold, that is called as lung capacity, and it is measures in liter and milliliter. Here the lung parameters are there. Mainly it is the tidal volume, inspiratory reserve volume, expiratory reserve volume, total lung capacity and vital capacity. Other than this also, PEFR, FEV1, PEFR is peak expiratory flow rate, FEV1 forced expiratory volume in 1 second. Next, factors affecting lung capacity. Which factors affect this lung capacity, which are responsible to reduce the lung capacity is mainly the patients with the COPD, asthma or pulmonary fibrosis, which get reduced capacity, leading to the shortness of breath and the decreasing automatically the quality of life. But aging is also an important factor to reduce the lung capacity. As we know that lung capacity starts declining at the age of 30, and at the age of 50, it almost get the 50% reduced. Okay. Then air pollution is also a main factor to reduce the lung capacity, as we live in Delhi, and Delhi is the most pollutions city of the India. Then along with this, COVID-19 lifestyle factors and physical factors is also responsible to reduce the lung capacity. Here are some lung capacities shown in the images. This is the tidal volume. Tidal volume is, it has a small waves. It is the air which is retained in the lungs after exhalation. That is the tidal volume. Here it is shown in short waves. And what is this? It is a big major wave which shows that a deep inhale and deep exhale is showing the full cycle of the inhale and exhalation. After that, there are the lung capacities. Inspiratory capacity is, normal capacity is the 3.6 liter, and vital capacity is 4.8 liter, and total lung capacity is the 6 liter. And in bracket it shows in the females. Next, Kunjal Kriya and lung capacity. Physiologically, effects of Kunjal Kriya: it strengthens the respiratory muscles, it enhances the diaphragmatic movement, increases the vital capacity, and this there are some studies shows the improvement in lung capacity after regular practice of Kunjal Kriya. There are two scientific studies. These are the pilot studies which are practiced on the 8 volunteers, but they have the results, significant results. In discussion, this it is the blood image. Sorry, in blood-brain barrier there is the NTS which activates the jugular ganglion, and hence its stomach mechanoreceptors activation. Then Kunjal Kriya activates on the respiratory system also. It enhances the, in uppermost corner, its respiratory, it enhances the respiratory smooth muscle activation. Hence airway decreases and lung capacity increases. Benefits of Kunjal Kriya: it clears the respiratory pathways, immediate relief from congestion. Long-term effect strengthens the respiratory function, increases the lung capacity with the regular practice. Precautions: some persons, okay. Contraindications: hypertension, heart disease, gastric ulcer, pregnancy. Conclusion: regular practice of Kunjal Kriya may increase the lung capacity, and it is the almost best when it practiced with the pranayam also. There are the references. Thank you so much.
Now for the last presentation, may I invite Anushri S.
Namaste, all the respected dignitaries and one and all. I, Anushri Urkude, presenting my paper entitled Tackling Delhi's Air Pollution Crisis, the Role of Ayurveda in Restoring Health. So let's start with the introduction. The national capital of India, Delhi, is amongst one of the most polluted cities of the world. As per the Lancet, Delhi reported having the highest annual population weighted mean PM 2.5 concentration, much above the Indian and WHO recommended limit. India's state-level disease burden initiative, air pollution collaborators. In Delhi, per 10 unit increase in the concentration of sulfur dioxide and particulate matter increases the respiratory disease-related hospital visited by 83 and 0.21% respectively at the previous lag of 0 to 6 days. It concurrently resulted in the release of substantial amounts of pollutants in the atmosphere, posing serious risk to human health. Acharya Charak explained in Janapadadhansadhyay the 4 factors that have been described which are common and essential for every living being, that is Vayu, Jal, Desh and Kal. Environmental pollution can be correlated with Janapadadhansa. Delhi's pollution levels are significant concern, especially during winters, when the city experiences a heavy smog due to various factors like vehicular emissions, construction dust, industrial pollutants and crop stubble burning in neighboring states. These pollutants contribute to both short-term and long-term health hazards for Delhi's residents. The present study is a small initiative to use Ayurvedic preventives and curative measures to tackle this serious condition on daily basis. Aim to explore the role of Ayurveda in addressing the health impact on Delhi's pollution crisis. Objectives are to assess preventive and curative approach of Ayurveda for restoring and maintaining health amid rising environmental pollution levels, to increase public awareness of Ayurveda's role in managing pollution-related health issues, and to promote sustainable Ayurvedic practices. Material and methods. A narrative review of Ayurvedic literature and research on the impact of pollution on health was conducted. Major health hazard due to pollution in residents of Delhi: respiratory illness, cardiac disorders, weakened immunity, higher susceptibility to various allergies, risk of cancer, impaired cognitive development in children, stunted lung development, and pregnancy complications. Health management with preventive and curative aspect includes दिनचर्या, ऋतुचर्या, पथ्य आहार and विहार, एकल द्रव्य चिकित्सा and रसायन चिकित्सा. Moving towards दिनचर्या, ऊषपान, then शुंठी एवं मुस्ता सिद्ध जलपान can be used. तेल गंडूश धारण, where तिल and नारिकेल तेल धारण can be used. कवल धारण with यष्टि मधु फांट एवं त्रिफलाक वात कवल धारण. प्रतिमर्शन अस्विक ग्रोगुत और अनुतेल. कोष्ण जल स्नान, व्यायाम, प्राणायाम, द्विकाल भोजनम. ऋतुचर्या, to follow all Ritucharya as per mentioned in Sahita with respect to today's lifestyle. In Delhi, effect of pollution are more visible in Hemant and Shishir Ritu. The regimen like Koshna Jalpan, staying in warm places, use of mask should be followed. Avoid adhesion to improve Agni and ultimately the well-being of a person. Intake of Rasayan Kalpa like Chavanprash, Brahma Rasayan, Agastya Ritki can be used. Ritu Shodhan, where Sharadiya Virechan, Vasantik Vaman, to prevent pollution-borne diseases like COPD, contact dermatitis, lung cancer. Patya Ahar and Vihar. Ahar Vihar, avoid eating in polluted areas, avoid excessive use of protein in name of nutrition, avoid use of processed food, avoid eating adulterated food with harmful preservatives, deep fried items and refried items. Vihar include overexposure to polluted areas, avoid exposure to poisonous gases, fumes in industrial areas, avoid diva swab, disturb biological clock, avoid smoking and passive smoking. Rasayan Chikitsa, Yuktivat Prayog of Dravya acting on Pranava Srotas. For example, Tulsi, Amal ki Yashti Madhu, Pipli, Shati, Kantakari, Pushkar Mul, Vasa, Duralabha, Karkashungi, Punarnava, Tamal ki, Harit ki, Bibit ki, and Raksha. As Kasa, Shwasa, Pinasa, Punaravartit Pratishay are the common respiratory symptoms that are reported by the patients. The major cause of above illness is continuous exposure to harmful air, contaminants, and Udavarta and Ajirna-like condition present in patient due to consistent unhealthy lifestyle, which further leads to initiation of doshas. Nitya Videchan with a good Haritki or Kalyan Vatak can be helpful to combat the long-term health hazards. Ritu Haritki can be used to restore various health ailments, as Haritki is the best rasayan dravya mentioned in the text. Discussion. On focusing on both preventive and curative measures, Ayurveda offers a comprehensive framework for mitigating the negative impacts of pollution on the body. In doing so, Ayurveda not only conclusion, the Ayurvedic regimen offers a promising holistic approach to combat the health impact of air pollution in Delhi. Patya Ahar Vihar, Kalpa containing dravya acting on respiratory system along with practices like Nasya, Pranayam, strengthen immunity. Wide plantation of dravya like Tulsi, Ashwath, Vata, Audumbar in pollution affected areas can be helpful in initiative to increase oxygen levels. Ayurveda provides valuable tools to enhance resilience against pollution. It must be complemented by broader efforts like policy changes, pollution control measures, and public awareness campaign to address the root cause of pollution for long-term health and environmental sustainability. Bibliography. Thank you.
So, thank you all the presenters without wasting a single minute, because kindly excuse, we may not take your questions. If there are any questions, kindly be connected to the presenter. We have today's co-chair and chair, very distinguished personality. The co-chair, Dr. Bhavna Parashar Madam, a principal scientist in the field of Ayurgenomics, is an authority. So, and our own teacher, Professor Ejmadi Acharya sir. You will be surprised to know that as early as 1985, sir started working on the Rasayana. In fact, the PhD work of Professor Ejmadi Acharya sir is on the Rasayana, and 39, 35, 40 years back, he started working on this, the immunoglobulin, the effect of Rasayana on the immunoglobulin. So without wasting a time, we would like to hear from Dr. Bhavna Madam first, and then lastly concluding remarks from the Professor Acharya ji. Thank you.
So, good morning everyone, and it was excellent session in a way that 10 presenters, all of them presented, and so longevity and rasayan, these two things were mostly covered in all the presentations. As we all know, longevity is dirgham ayu smritim meda arogyam tarunam vaya. And dirgham ayu, so ayu has 4 components, sharir, indriya, sattva and atma. So if we were to work towards dirghayu, we have to address all aspects of sharir, indriya, sattva as well as atma. And that can be done through lives, very well articulated by our keynote speaker as well as few more speakers also. For that we have a lot of regimes like dinacharya, rutucharya, diet, lifestyle, sadvritta, entire swasthvritta chatushka is there in where also sequentially they have addressed sharir as well, and the 8th chapter is about indriya related. So it's actually division of sharir, indriya, sattva, atma related, all aspects to be taken care for remaining healthy and in a longer life, right? But if we were to, then what is the need for rasayana? If there is such a beautiful depiction of swasthvritta, why do we need rasayana? In rasayana you need when you actually want to actively work towards increasing the lifespan or maybe enhancing the quality of life. Rasayana is also applicable, you would recall, it's called praya prayana roganam dvitiye prashamam matam praya hi shabdo visheshartho ubhayam hi ubhayarthakut, which means that even the vyadhihar things can be rasayan, and rasayan can be applied even in the vyadhihar condition. So when there is a vyadhi, that time also we need to strengthen the weakened systems. So at that time you need rasayana. So rasayan would have an application both in disease conditions as well as for overall enhancement of health. Now what mostly we heard through the talks was how does it act, what does it do, or whether it is immunomodulatory, whether it is antioxidant, whether those are like explanations that we can think of in telling how rasayan would be working. But rasayan has been working according to Ayurveda on some aspects, right? So my advice to the younger generation would be, whenever you do some practical work on rasayana, in addition to looking at the modern explanation of how it is working, you should not forget to see its effect on Agni, its effect on, Dhatu Sarta, its effect on Ojas. I never heard anybody speaking about Ojas all throughout longevity or rasayana in the whole session. Just wanted to remind all of you that in a quest for explanation in modern science, we should not forget what we understand by rasayana, proper Agni, proper assimilation. Most importantly, we have Samanya Vishesh Siddhanta. We want to enhance certain things, but we would also want to take care of things which are causing damage. So those those detoxification measures, because you remember rasayan, for the name of the chapter of the rasayan is Abhaya Amalakiya Rasayan. Just think about it. Why these 2 drugs are only named? You people yourself listed so many rasayana, but the chapter name is by Abhaya Amalaki Rasayan. Why so? Because Abhaya is mostly a Shodhan kind of a nature, and Amalki is a Shaman kind of a nature. So rasayan by nature will have 2 approaches, Shodhan and Shamana, and very elegantly Charaka has named the chapter of rasayan as Abhaya Amalkiya Rasayan. So these are the certain things which I just wanted to highlight, because we sometimes miss out on the fundamental things that are described. When I said Ayu, it's Sharir, Indriya, Sattva, Atma, Sanyog, Dhari, somebody who holds it. So it's not just individually Sharir, individually Atma, Indriya. It's something which is holding it together. Now what is it that is holding it together? You would know Ojas has also got a synonym of dhari. Okay, so why ojas? Because about ojas they also say that hridayastham api vyapi deha sthiti nibandhanam. It is actually holding control of the whole and control and coordination. So individually you might do very good to individual tissue systems, organs, but something which will have a better coordination, a better control over the system, and better signaling amongst the system. And that's what calls for rasayana. So, so these are the things, I think these are fundamental things described in Ayurveda, and they will provide better explanation into what would it be called in modern science, whether it will be antioxidant, whether it will be immunomodulate. Those could be different dimensions of rasayana, but there may be some more regulatory aspects which are being talked about in terms of ojas, which if enhanced or functioning properly will lead to rasayana effect, which is like dirghamayu, smriti. So connect the biology within Ayurveda with the medicine aspect and connect it with the intervention aspects is, I think, what we must all strive towards. A lot of students also talked about their practical work. Most of them actually talked about the review aspect, but some of us also talked about the practical work. And I think that's the seeding that happens in the educational institute, and I'm very hopeful that in your future life, during the research, all these things will be taken forward. With that, I would like to end my conversation with you here, and thank you all for, and I would like to really kind of thank organizers, Professor Nesri Madam and all the team of hers for having me here with you all. Thank you.
Thank you, ma'am, for your insightful remarks. Now, may I invite the chairperson of the session, Professor S.H. Acharya, sir, for the concluding remarks.
Thank you very much for keeping me on the chair today. We are very happy that this series of program on the presentation of the research is going on. I was just going through the papers. Of course, I congratulate those who made the paper presenting. But definitely, I'm a very adherent to the, very ethical person speaking on the truth. There is a big scope for improvement on the topic and the paper presentations among you. But there are a few things I saw that a couple of you from the undergraduate level have taken, confident enough to come and present. I really congratulate them for doing that and wish them really a good future in that. I will not take much time because I know we are already too much gone beyond the prescribed timings. I am really astonished Dr. Bhattad remembered me. Yes, I did my PhD, submitted in 1989, on the management of aging with Rasayan. So we worked on the human biological markers of aging from NIH, from United States. I tried to retest on the local population at Jamnagar and then use the, I will not talk details on this because we have no much time here. But it is very important, as Madam Dr. Bhavna also told, I actually expected something she will speak on aging genomics, but however we have a very short time, she threw some light on it. Actually, as she told, the Rasayana is not one single entity. There are so many different dimensions of Rasayana. When we use it on very specific things, it should work it should be used in a proper manner. Labho upayohi, the word is there in definition of Rasayana. It is not just the molecule as a Rasayana. Of course it does. But you have to motivate it. Upaya is important. How you use it. Amalaki at random uses quintals of Chavanaprash. People eat in India. You probably do not know how many companies prepare and what is the consumer really the rate. But as our keynote speaker said, the blue zone is not in India. You should have been here. You eat quintals of Chavaprash. Why? The question comes, why? So it should be used in a upaya is important there, what Charaka has told. Then only it will work in a definite manner, in a targeted manner that works. There are so many things. Actually, hardly few people touch the topic of senility. Adaptability, anti-stress, or immunoregulation does not directly touch the senility. No doubt, it is affected in the senile process. Other than the speaker, the people did not touch the senile process. We do have rasayana, very specific to the senile pathology. That is why Charaka Samhita has done it an exclusive Vayasthapaka rasayana. That's very specific, that we have many other rasayana. Balya rasayanas are there. The thing is, one herb you use, it does not work in one manner. Amalaki for it. It's a very good balya. Balya rasayana is what your adaptability is, immunology, you are working there, your strength, anti-stress and everything. Vayastha is again something that Ayurveda has recognized, the senile process of, there are certain markers actually. We can do aging of the cells and other things. What our keynote really he made, that was I remember in 2011. It was a boom when that article published. We had Dr. Bagel was there as that. We had a discussion at that time, I remember, on Drosophil studies. So we have very less studies, and particularly clinical studies, we are lacking in Ayurvedic front, even from the modern side also. I am here since, since 1 week in Delhi. There are many papers who is touching on the pollution in the Delhi town. I have been coughing and a little bit concerned about my health, and Dr. Bhatta gave advice, some Yoshadi Vati. Still I am swallowing it, and my health is a little bit, and some blessings of Ashwagandha. So whenever I come to Delhi, stay for a days in a month, I have to protect myself. I know that. Now particularly the pollution is, winter comes and it's on. You see, when you buy, I always keep joking little bit things that when you buy an iPhone, or when you buy a car, there is a period that the company gives a warranty period. You know, you are very safe, happy, and you can risk anything. Once it is over, then AMC is little bit very costly for you. So physical body has also some warranty. After we cross the warranty, then maintenance is a little bit costly thing, you know. So even Ayurveda, the Samhitas, they knew this warranty period of the body. This is, if you really want a promise of Rasayana, please, it should be in the warranty period. Labho payohi shasthanam rasadinam rasayanam, definitely, but he says it should be purve vayasi madhyeva. That is the right period. If you want to expect the effect of rasayana, see, the warranty period is there. So, but it does not give any benefit in the aging. Yes, it does gives benefits. After a person crosses or comes to the Jaravastha, there are different dimensions that you can. Can we reverse the aging? They say it is a Swabhavyadi. Sa nishpratyanikaha. This is you. There is no antidote. Nishpratyanikaha. You can, but still, as Rasayana and other things you use is yapya. There is something as management field you have. You can manage during the period of aging, having good health. There are different, as they say, we have got ayu. We can improve upon the ayu. Ayurbala is one of the important thing that we have. Measuring ayu is a very in the center of Ayurvedic clinics, because most of us confuse Dashvida Athur. We say that, oh, Athur Pariksha, that's for no, Dashvida Pariksha is actually never for diagnostic purpose. It is the assessment of the patient. What are those? Ayu Pramana, Bala Pramanascha. Here he has not a diagnosis of the illness. We confuse Ayurveda. Our clinical approach is totally different. And our research also has to be different. This is what in past few years we are making effort. Yesterday we released the transdisciplinary protocols. How to keep the Ayurvedic ethics in front and then make research. Most of the research we make something like a clinical drug trials, which are not actually touching the concepts of Ayurveda. And also the practicing Ayurveda. I just had some with our international scholar discussion. They were telling that if we use the Sampradaya Vaidyas, and you suppress them, maybe we are missing so many things in our society. We must also keep regulation, how to encourage them also, because we know our trend of Ayurveda practice has changed a lot. We are missing samhitas. We are trying to promote here also Samhita-based clinical practice. We are putting some force. So in research also we will try to bring some concepts of Ayurveda, into your research. Couple of them I will not mention, like one of them done by Mrudvika, the basis of consideration is Shramahara Kashaya. Say here you are touching the concept, and in your research you want to see that how Shramahara is working. You have a basis of Ayurveda. When you walk on the footsteps of Ayurveda, Shastram Pramanam. So this is how we can little bit modify and present ourselves. I will not make too much of my talk on this, and I will hand over the mic to the organizer. Again, I am very much thankful that I was given an honor to chair here. Thank you very much.
Thank you, sir. Thank you very much. So, in the continuation of the last session of the program, I would like to invite Professor Bhatet, sir, and to felicitate of token of gratitude, shawl and memento to the keynote speaker of the today's session, Professor P. Murli Krishna, sir. I also invite chair and co-chair, sir.
Apologies. Shortly, Ricardo Gelman sir will be with us online, and he's going to speak on translational research and integrative medicine. So let's yes. Quickly, let's move on to the felicitation. May I please invite chair, co-chair and moderator to present this token of gratitude to our keynote speaker. Thank you, sir, for being with us today and for having this enlightening talk. May we have a big round of applause. Now, I would like to request Professor Santosh Kumar Bhatter sir and Kamal sir to present this token of appreciation. To chairperson S.H. Acharya sir, quickly please bring the mementos and the shawl. Can we have a big round of applause for this moment? Now I request to do the honor to our co-chairperson, Dr. Bhavna Parashar ma'am. Thank you, sir. I request Kamal sir to present the memento and the shawl to our moderator also, Professor Bhatter sir. Thank you, sir, and thank you, ma'am, for giving your time and for chairing this session. So with this we conclude this session, but last but not the least, I would extend my heartfelt thanks to all the participants and to all the delegates who have been there throughout the session. Thank you once again.
A very good afternoon to everyone. We have an online lecture here who is joining now, so we request everyone to please be seated. And we are just starting the session. Due to some technical glitches, it was expected in the next room, but it will now happen here. Because in that, VC is not possible, so we request everyone to please be seated.
You all are requested to please be seated. We have our international guest who is going to join online, and he is going to deliver on the translational and integrative medicine. You all are requested to please take your seat. The felicitation of all the participants of this session will be done after this lecture.
person, Ricardo Goodman, who is the person. Request you, sir, for your deliberation.
That's
only that.
Yes. Yes. The participants and all the delegates and invitees, they are requested to please take your seat. Shortly, we are about to start the online session. Join करो. So the session on the longevity has been declared concluded. All the participants, if they are present here, they may take their certificates from the 7th floor. And meanwhile, we are approaching towards one more deliberation by our international speaker. Shortly is going to join us online. And after that, we will have next paper presentation session on mental health. There is one more announcement. May I have your attention, please? The participants who have enrolled for the paper presentation on translational research and integrative medicine, the venue has been changed. They may proceed to the Dhanvantri Hall for their presentation. The paper presentation session of translational research is going on in the Dhanvantri Hall. The participants can move on to that venue. With great delight and pleasure, today we have with us our international and a very renowned personality, Ricardo Gilman, sir. Sir is a professor in the Department of Medicine on Primary Healthcare, Federal University of Rio de Janeiro Medical School, founding chair in Brazilian Academic Consortium for Integrative Health. Also, sir is WHO expert on traditional, complementary and integrative medicine, focal point on ICD-11 traditional medicine too. Sir, you are invited to our session and we request you to please proceed with your deliberation. Sir, please.
I'd like to thank all the organization, our Indian Institute of Ayurveda, WHO, and I'd like to share here. And I'd like to ask if it could be shared my presentation that I sent by email.
Sir, you can share your presentation at your end also. We have made you the presenter.
And I'm trying to share here, but I'm not sure if it's available here in my computer. I sent my presentation, would be fine?
Sir, are you using the MacBook?
Yes.
So then in that case, permission is required. See if you are able to do it at your end or else we will try from our end.
Yes, I'm trying to allow the permission.
So we request you to please share your presentation to Dr. Manisha on WhatsApp. Then we will share it from our end.
I think I can, just 1 minute, I think it works now. Yeah, unfortunately, don't allow me to share now.
Sir, then we request you to please share your presentation to Dr. Manisha at her WhatsApp number. Then we will share it from our end.
Okay, I do now. I'm sharing by WhatsApp. Yes, I shared to Dr. Manisha now.
Yes, sir,
by
we'll
WhatsApp.
be doing it. So we'll be doing it shortly.
Thank you very much. What's
Sir, is the presentation visible to you?
Yes. Yes, please, if you could follow, then I can see now. Perfect.
Okay, sir, then we can proceed. Sir, it's all done from our end. You are requested to please proceed with your talk.
Okay. Then I'd like to introduce saying that from the last years, the research on integrative medicine and health is growing very fast, and a bibliometric evaluation shows that after China, US, and South Korea production, that is the top 3 countries nowadays in the publication, we have the Brazil, India, Germany, and other countries becoming very important in the arena of research. And from the Brazilian research agenda, the natural products and even herbal medicine and traditional Chinese medicine, its most important contributions nowadays. Filling the gaps in the primary healthcare system that in the last 20 years you can see simultaneously with the reduction of communicable disease, we can the increase in a very strong way of mental health disorders, iatrogenesis, and chronic non-communicable disease. Then, looking to the perspective of the Minister of Health in Brazil to implement the national policy of traditional complementary integrative medicine informed by evidence, was commissioned the evidence map in a collaboration project between the Brazilian Academic Consortium and BIREMI, that is the Center of Health Information from Pan American Health Organization, to provide support of evidence-based decision-making among health professionals, policymakers, researchers, and the public. Since 2019, we developed the evidence map based on the International Initiative for Impact Evaluation and focus on systematic reviews. Looking to the total amount that was gathered, we did until now 28 evidence maps, gathering around 2,200 systematic reviews of integrative medicine. And what we found is that the big amount of data come from initially from medicinal plants, followed by meditation, Chinese body practice, acupuncture, and yoga. And then that amount of information can help the policymakers to provide implementation based on evidence, and the request is growing more and more also to evaluate the main outcomes. As you can see, the main area of outcomes are concerning the mental health nowadays, followed by well-being and the other specific fields like diabetes, cancer, hypertension that englobe the non-communicable disease. Then looking to that first step of 5 years, we can ask, you can answer the question, can we fulfill the gaps in primary healthcare system? The answer seems yes. As a first experience to implement a policy based on that evidence map, from the requirement of specific secretary in São Paulo city, that it's a huge city, we developed the guidelines from chronic pain based on that evidence map. We did one specific required from the PAHO, that's the evidence map to chronic pain, and we found 5 medicinal plants with high quality studies and positive effect: aloe vera, curcuma longa, Arpagophyton procumbens, Gengibre officinalis, and Salix daphnoides. Then, from that experience in the settings looking from the perspective of the one amount of data, and with the separating the high quality and positive effect, the guidelines can be built. One important step to provide the evidence to Ayurveda medicine was a request to include Ayurveda. Then I would like to share the preliminary data about the evidence map on effectiveness of Ayurvedic medicine that we did, looking to the question. The question need to be followed with the PICO question: what the effectiveness of Ayurveda medicine practice for health outcomes? And we found in the first search, using the strategy from PubMed, Embase, and several other databases, 32 systematic reviews with the goal to give visibility to available scientific evidence of clinical effectiveness of Ayurveda medicine. In the first step, the primary findings shows that from the 207 list of articles, 47 come from India, and the second country from Iran and Sri Lanka and other countries. And the publication are focused on safety and efficacy, full of effectiveness. Mainly looking to the effect, we found the 45 sorry, can you share? I'm talking, but I can see if you are sharing. Okay. Looking to just continue, looking to the
So,
to
can
the
you please
effect.
tell us on which slide we are supposed to shift? The slide number?
I'm the 14 now.
14th one. Is this the one, sir?
Yes. No, it's not this. Please come back. Have to come back. Please have to come back to.
So can you please tell the title of the slide? Just tell us when to stop. We are scrolling it one by one.
Before, please. Yeah, I'm here. About effect. Yes, this, please. Thank you.
Sir, it's just a request. Whenever you are switching up to the next slide, just please tell next slide so that we can do it from here.
Okay, thank you. Then we're talking about the effect of these 32 systematic reviews that gather in Ayurveda. Looking to the positive and the potential positive effect are the main findings. Next, please.
So we have changed the
looking
slide.
to yes, thank you. And looking to the population, we can see beside the general population and healthy people, we can see the children and the diabetes. It's one of the specific areas. And looking Next, please. And looking to the list of intervention, you can see that we separate the Ayurvedic formulation, Ayurvedic herbs as the main areas of intervention, but also some other Ayurvedic practices, mixed Ayurvedic intervention like multimodal approach. And the main outcomes, this is important in the right side, which area we found more amount of data. It's in the field of dyslipidemia and diabetes and markers from diabetes like glycated hemoglobin, and followed for schizophrenia, cognitive performance, pain. This is the number of the outcomes that you found in the systematic reviews. You can see a big list in the right side. Next, please. Follow from the specific areas. Then it's a big range. And looking also to adverse events, we found 24 data from the adverse effect, and the 18 not evaluated, and the 12 without adverse effect. Next, please. This is a big chart, not to go in details, but how can we combine one specific intervention, one with specific outcomes, and evaluate the effect. If the effect is positive, if it's potential positive, and from this evaluation, next please, we did the evaluation of the quality applying the tool Amster tool, that it's a very it's need to be applied as the tool to evaluate the systematic review, but the requirement is very high. It's very easy to follow in the low and critical low evaluation. But this is the evaluation that you had in the 32, mainly are low and critical low in this moment. And just to conclude that first part of the presentation, you can see here the names of the all 32 systematic reviews. Next, please. That it's the first step. Now we are under development. The new search, and including the yoga that it's not included in this moment, the amount of the studies just in yoga, it's more than 100 systematic reviews. Then it's just the first review. Next, please. Looking to the translation research in Ayurveda, I'd like to present 5 notable examples of how you can apply the potential integration of Ayurveda principles with modern biomedical research. And next, please, I'd like to start with that beautiful project named Ancient Modern Concordance in Ayurvedic Plants. I study that highlight the scientific validation of Ayurvedic plants through modern pharmacological research. For instance, the isolation of hypertensive alkaloid hezerpine from that plant that is traditional use in Ayurveda for treating hypertension, insomnia, and insanity. And then it's a wonderful, successful translational research. Then from the resin of comifera, VT has been investigated of lipid-lowering properties, also leading the development of modern anti-hyperlipoproteic drugs. Next, please, as a second example, we have the whole genome expression and biochemical correlation with Ayurvedic constitutional types. It's a perfect example of ancient and modern cooperation in evaluation, the personalized medicine approach to modern healthcare. then it's very important to continue in that field and applying the diagnostic constitutional evaluation with the genetic evaluation. Next, please. The third example, it's about the applying to osteoarthritis that come from a systematic review and meta-analysis by Kessler that evaluation the safety of Ayurvedic intervention for osteoarthritis. And that study found that Humalia and Shanti Gudici demonstrate the pain reduction at global improvement. This seems a very important candidate to chronic pain that is very common in osteoarthritis. Next, please. And following also the connection between genomics and the evaluation of the concepts and the common constitutional evaluation. This is very known in India, but now for other countries, it's considered a very top project of our genomic that need to be spread. It's very important. And the next, please, the last 5, and this is the 5th example in Drosophila model evaluation, the traditional Vedic formulation from in various physiological parameters in Drosophila that shows the correlation with what is very traditional indicated from longevity, stress tolerance, and fecundity. Next, please. Looking to the example from the translational research made in Brazil, we have in the Amazonia area that plant, Paullinia cupana, named popularly Guaraná, that have a big amount of alkaloids such caffeine, theophylline, and theobromine that was used traditionally to improve the energy to the traditional community in Amazon area, and have interesting amounts of antioxidant effect and inhibit lipidic peroxidation. Then the first data from in vitro and in vivo studies shows anti-inflammatory effects and reduction of cytokines level, showing a psychoactive, antioxidant, and anti-inflammatory properties. Next, please. In the application of this plant in cancer patients, that was perceived important reduction in fatigue related to chemotherapy, increased appetite, weight stabilization, and reduced sleepiness. But the fatigue was very interesting, demonstrated compared to placebo. Next, please. Then from the in vitro and in vivo, we start to apply to clinical trials comparing the placebo and guaraná, showing in that randomized double-blind placebo-controlled trial the reduction of the fatigue. Next, please. The mechanism was not clear, but we evaluate the anti-inflammatory action mechanism of Paullinia cupana, the guaraná, and even that you saw the anti-inflammatory properties, this seems to explain the anti-fatigue activity. This is an ongoing project. Next, please. And next, please. From the same region in Amazon area, there is another plant, Uncaria tomentosa, cat claw, that is used also to give energy, it's common in that area. We use it not only in Brazil, but all Amazonic countries. And specifically in the studies of the bioactive metabolites was found oxindole, indole, and other alkaloids, and it's different triterpenes action. Then was started looking to the same pattern of the Paullinia cupana to evaluate the effect in fatigue-related symptoms of chemotherapy. And the first study was a single institutional prospective study with 51 patients with dry extract of that plant with 100 milligrams 3 times a day, that receive award in the ASCO meeting, that it's most important meeting about conventional oncology, and was shown that in advanced solid tumors patient, the quality of life was increased. Next, please. It was evaluated the quality of life through the conventional and very used questionnaires, showed the reduction of the fatigue and the increasing the quality of life. Next, please. But the parameters to evaluate the inflammatory markers levels, like interleukin-1, 6, and others, didn't show any important changing. Then compare with Paullinia that have impact in that parameters, this Uncaria tomentosa that plant don't show. Next, please. Then the last experience was to join the two plants in a synergic way, and this study concludes that the combination of that two plants shown as safe in patients with solid tumors, and also the benefits of not only to reduce fatigue, but also to reduce nausea and vomiting, showing a very interesting candidate to be applied in the conventional treatment of oncological patients. So just to conclude my time, next please. I would like to invite you all, everybody, to join to the next World Congress of Traditional, Complementary, and Integrative Medicine that will happen in Rio de Janeiro, Brazil, next year, exactly in 1 year. The main topic, the general topic of the Congress will be the strengthening global public health through traditional, complementary, integrative medicine, presenting and discussing the knowledge diversity, well-being societies, and planetary health, inspired with traditional knowledge and powered by research. Next, please. Will be the first time in Latin America, following the Congress in North America, and we hope. Next, please. Yeah. It's not so configured, the slides, but you want to show the 6 presidents from the 3 institutions that it's organizing the Congress. We have 2 from each institutions, Ricardo, myself, Mariana Schweitzer from the Brazil, Nadine Jas Holger Kremen from the ISCMA, International Society of Research in TCM, Nadine from Canada, Holger from Germany, and from the European Society of Integrative Medicine, Jörg Seifer, that it's now with you, and Hiba from Africa, that belong to the group of Charité. Then we 6 would like to invite you, and we hope that you could share our experience from the whole 6 regions in Rio. Next, please. Thank you very much, and welcome to Rio. Next, please. Thank you.
Thank you so much, sir. We are indeed honored and delighted that you have joined online, and that too at some weird time. It's 3:30 in the night at your place, so we are really very honored to have you with us. And it is really a delightful moment for each one of us that different perspective of the Ayurveda medicine and the research is related to Ayurveda you have exhibited in front of us. So thank you, sir. We are really very honored. Thank you for your time.
Thank you very much. And wonderful Congress. Thank you.
Definitely, sir. Now we are heading towards our next paper presentation session.
Good afternoon, everyone, respected dignitaries, esteemed participants, scholarly delegates. A heartfelt welcome to all of you. Welcome to Day 2 of Aroha 24. World Mental Health Day is an annual awareness day observed every 10th of October. We are gathered here to exchange ideas and open discussions on the topic Ayurveda for management and promotion of mental health. It is indeed a golden opportunity for each one of us to enrich and enlighten ourselves. This session is chaired by Professor Dr. Shri Krishna Sharma Khandel sir, retired professor and chief consultant at Arogya Lakshmi Healthcare, Jaipur, and Dr. Pravit sir, chairman, Center of Applied Thai Traditional Medicine, Mahidol University, Thailand, and moderated by Dr. Ramakant Yadav sir, associate professor, Department of Kaya Chikitsa, AIIA, Delhi, and Dr. Ashutosh Yadav sir, associate professor, Department of Rashna Sharir, AIIA, Goa. We would like to call upon the stage Dr. R.K. Yadav sir for presenting Green Wealth Welcome to Dr. Khandel sir. Please give a huge round of applause. We request sir to take a seat. We have two key eminent speakers with us, Professor Dr. Shivram Varambali sir, Professor of Psychiatry, National Institute of Mental Health and Neuroscience, Bangalore, and Dr. Antonio Morendi sir, founder and director of Ayurvedic Point, Italy, who will join us online. We would like to call upon the stage Professor Dr. S.K. Khandel sir to welcome Dr. Shivram Varambali sir with Greenwell. Please give a huge round of applause. Our first key speaker is Dr. Shivram Varambali sir. He is a professor of psychiatry at NIMHANS, Bangalore. He has received an award for Distinguished Speaker Oration at the Indo-Canadian Psychiatrist Association at Toronto, Canada. Sir has an extensive research experience in the areas of neurobiology of psychosis, schizophrenia, and the use of yoga in psychiatric disorders. Sir has more than 170 publications in various peer-reviewed and indexed journals. Let us put our hands together to welcome Professor Dr. Shivram Varambali sir for his deliberation. Over to you, sir.
Thank you, madam. I'm very happy to present here in AIA. Particularly, I'm very happy to have met Dr. Khandel, who seems to be a guru to most of the people who are in this institution. So I am going to not teach Ayurveda to you. I am not Ayurveda expert. So I am not really going to talk about Ayurveda. I am going to talk about what is the need for Ayurveda in mental health today. What is the role and what we expect from the Ayurveda fraternity for mental health. So this is the outline. So as you all know, the major problems we deal with on a daily basis are the severe mental disorders and the what are called the neurotic mental disorders. And this is a problem that the severe mental disorders are something that has not changed very dramatically in terms of the prevalence, but the other minor mental disorders have taken a real jump in the recent years, especially after COVID, anxiety, depression, other conditions, and we really have great difficulty handling the the amount of people who have these problems now. It's not that we don't have treatments in modern medicine. We have antipsychotics, antidepressants, anxiolytics, which are pharmacological methods. We now have an increasing range of brain stimulation treatments. Of course, the oldest is electroconvulsive therapy or shock therapy as it used to be called. But we have newer modalities like the repetitive transcranial magnetic stimulation. We have even vagal nerve stimulation. We have something called transcranial direct current stimulation. So there are many methods to treat psychiatric disorders. We have a host of psychological treatments like cognitive behavior therapy, interpersonal therapy, psychodynamic therapies, group therapies. We also have a lot of psychosocial interventions. So in spite of having all these things, what is the problem we are having is the question that, as you all know, for the chronic disorders, whether it is the physical diabetes, hypertension, or the chronic psychiatric disorders, medicines have their own limits. And in a country like India with a population that we have, you would probably need 2 or 3 crore trained psychologists, because the prevalence of mental health as per the recent mental health survey is 1 in 4. 25% of the population have some mental health issues. It's impossible to reach psychological therapy to all these people. And the good thing is, in the last 10-15 years, there is a renewed interest in yoga and Ayurveda, particularly with modern scientific approach, as Dr. Prashar, other people here, combining the best of the modern research methodology with the traditional knowledge. And what we have found very interestingly is that when you combine a traditional method of treatment and a modern method of treatment, you tend to get better results than either alone. And that's the great thing for us. We should remember he is the guru for clinical medicine across the world, Robert Hutchison, who described his methods of examination of a patient, and he has very nicely said that if you forget the old in the new, then you are likely to get into trouble. And another author whom I very greatly admire is Fritjof Capra, who is a theoretical physicist, quantum physicist, who has now turned its attention to healthcare as well. And the Cartesian approach, so the 17th century, what happened is that they tried to separate the mind and the body, and they looked at the body as a machine. Descartes said, okay, a machine, you should be able to take it, all parts and then put it together. It is just a machine. Unfortunately, the human body is not a machine, and almost 2 centuries we went away from this idea that the mind, the body and the soul are all interlinked. We try to look at the body as a machine and we went wrong there. Why are we, so worried about this thing now? You look at the correlation between physical and mental disorders. It's a huge correlation, particularly for people who have depression. Anxiety and depression are very, very common, and any psychiatric diagnosis increases the risk of developing diabetes. Why is it? Sedentary lifestyle, lack of activity. On top of that, you give medications which reduce your metabolism. So this is a problem. It's a bidirectional relationship, and it's a big problem that people who have mental illness tend to live on an average 10 to 15 years less than the general population because of all these problems. Very interestingly, it's also the other way. What puts us at cardiac risk? It's primarily the psychological issues. Everybody talks about stress, stress has become one sort of bhayanak word now. Everybody says, anything you ask, stress, I have stress, It's not that it was not there before. What is stress? My simple definition is a simple tension which is repeated endlessly. Something that, because stress, the hormone cortisol, for example, all of you know, it's a very important hormone. If I want to suddenly avoid something when I am driving, I need that adrenaline, I need cortisol. But if this becomes the whole day business, 24 hours my cortisol is high, then I will get into the trouble. So if you have a psychological problem, you are more likely to have cardiac problems. Like our old Hindi movies mein dikhate the na, shock lag gaya, mar gaya aadmi. It is dramatic, but in a long term it is true. So this is a problem. This is a very interesting term. This is a recent term, what is called DOHAD, Developmental Origins of Health and Disease. When do we develop the vulnerability to both physical and psychiatric problems? This happens around birth and in the first few years of life. This is now being increasingly recognized. That is something that Ayurveda has told us long back. There is so much about Garbha Sanskar, what should be done in the early childhood. This was not recognized in modern medicine. Now we are beginning to realize that the early childhood is a very critical point, and this lies so we, for example, most psychiatric disorders, we say something called as the double hit hypothesis. So there is a vulnerability that may be genetic, maybe early childhood, and then something happens when you are 18, 20. One of the problems with psychiatric disorders that it, unlike diabetes, for example, which comes at 40, 45, okay, I have done a job, I have developed a family. Schizophrenia, depression comes at 17, 18, 19, 20. You have not chosen a career, you have not had a relationship, you haven't really finished your education, and it destroys your life. So that's the problem, and we recognize now that this is very, very critical, and early life stress induces diabetes, hypertension also. And it also, I don't only mean biological problems in early childhood, it is even the stress that kids go through. We, for example, in Indian system of schooling, we tend to push our kids into very difficult things early in life. 5 years में उसको ABCD पता होना चाहिए, mathematics पता होना चाहिए, सब everything they are supposed to learn. You look at, some other cultures, for example, Finland, till 7 they are not even allowed to write ABCD. It's only play or it's some molding and whatever. So, we put kids under extreme degree of stress. On top of that, if they have physical stress, mental, sexual abuse, physical abuse, this is what's going to happen. What is the most sensitive area in the brain? It's what we call as the limbic system, the amygdala. That is what reacts to this, and there are studies to show that there are actually amygdala thinning in kids who undergo abuse. So this is now called as the PNIE network. So psycho-neuro-immune endocrinology. This is the network that presages most psychiatric as well as metabolic problems, right? So this is what it leads to ultimately. We have a metabolic syndrome, we have immune dysfunction, we have hypertension, so autonomic system is imbalanced. And something called allostatic load, this is something all of you might have heard, it's a very important term. What is allostasis? All of you would have heard of what we call homeostasis, right? That is what maintains our temperature, our, all our things, in spite of external changing. I am in Himachal Pradesh today, I am in Kerala tomorrow, my body can adjust. That is homeostasis. But how does it do that? By this process what we call as allostasis. So a lot of things have to happen. I of course change my clothes, but other things have to happen so the body can adjust to the change in the temperature. And this allostasis, to do this, we put a load upon our system. So if I have cold, I shiver, my temperature goes up, but for that, lot of things have to be activated, cortisol has to go up. So this is the cost that we pay to maintain homeostasis. And this concept is called as allostatic load, right? And there is a certain load which we can bear. Beyond that, if we go, then you start getting. So for example, what happens when cortisol is high for a long period of time? It induces the fight-flight response, your noradrenaline goes up. When it becomes chronic, the other wear and tear of the body is not handled, and then you start getting kidney damage and liver damage and everything else. So this is a very important concept that we have to understand, what we now call as the dimensional model of health. So, this is a resilient system. That is where we should be, right? We can take these changes. I cannot eat today at all. I fast today, I get 3 meals tomorrow, my body should be able to do this. This is called resilience. Okay, you are not in that, at least you should be in an ordered system. Okay, I need 2 meals a day. With less than one meal I get a problem, but okay, I can manage with 2 meals a day. Then you go, you have a lot of allostatic load. Even with 3 meals a day, you are not able to manage. Then you go into a diabetes state where you need insulin or you need medications. And in the end, of course, this leads to end organ damage. So this is a cumulative biological stress that we are talking about. How do we translate this into practice? So let's say I have a pneumonia or I have COVID or whatever it is. Okay, I may need an antiviral or an antibiotic, but that's not enough. We need something that reduces the allostatic load. Why did so many people get COVID twice, some people didn't get COVID at all? That's the allostatic load difference between people. Doctors had, many of us had double because we were working in hospitals, but even otherwise it happens. Now where is this allostatic load reducer coming from? Allopathy has nothing. Modern medicine does not have something that reduces allostatic load. This is where really the Ayurveda, the yoga come into the question, because we need not to just not be depressed, I need to be mentally healthy. This concept in modern medicine is really not there. So we have to build and get person to that resilient stage of health. That's what we need. And of course we all know this. This comes from the Bhagavad Gita, that you need to do everything in moderation. Yuktahara viharasya yukta chestasya karmasu. Do things in moderation, including activities, sleep, everything, and then we follow the yoga system of life. So what do we mean when we say integrative medicine? You have traditional, Dr. Gelman was speaking about Brazilian herbs and Brazilian things. Just like that we have our own systems, including yoga, Ayurveda, many other Siddha systems. But we also need the modern biomedical systems. I have a fracture, we need to fix it. Most importantly, these should be evaluated using modern research methodology. That's the need of the day. So this is what we am talking about. How is this possible? So NIMHANS, for example, has had a CCRS unit since 1959. It was recognized at that time after the Bohr committee report that it was needed, and it has gone all the way now in 2019 that we have a full-fledged Department of Integrative Medicine. And this is in the logo of NIMHANS. Professor Govinda Swami, who was the first director of NIMHANS, was a noted Sanskrit scholar. He put this in from the Bhagavad Gita, Samatvam Yoga Uchyate. This was there in the logo of NIMHANS from that point of time. What we have done in the last maybe 15 years is to develop specific yoga modules for different disorders, because all yoga is not the same. Every yoga is not good for everybody. So we have developed specific modules which we have developed from the text, tested the feasibility, asked experts, finalized it, and then tested in randomized controlled trials. And I won't go into the details, I just want to summarize in one slide what are the things that we have done. For example, depression, we have not only shown improvement in symptoms, but we have shown decrease in cortisol and increase in something called as brain-derived neurotropic factor, BDNF, which is an important marker of what we call neuroplasticity, the ability of the nervous system to repair itself with neuroplasticity, and BDNF is a marker of that. Schizophrenia, we have shown again improvement in symptoms, improvement in what we call mirror neuron activity and connectivity of brain networks. Very importantly, in the elderly, we did a study where we were able to show actual increase in the size of the hippocampus after 6 months of yoga. Mind you, these are all people above 60, so all of us have hope, those who are in the wrong side of 50. This is the finding I was talking about in the elderly, that we were able to see an increase in the size of the hippocampus. One of our PhD thesis, Dr. Hari Prasad, who actually was an Ayurvedic doctor. This is what a study, slide from a recent study called as the Y-scan study, where we looked at schizophrenia. We were able to show difference in brain connectivity after yoga. This is the combination of two studies from NIMHANS, the NICE guidelines. The National Institute for Health and Care Excellence is a recommendatory body in the UK. The whole UK follows their guidelines. They have added yoga as a complementary treatment for schizophrenia in 2014. The Indian guidelines still don't have it. And we published this book in Amazon. It's available on Amazon. We've tried to put all our research together through the Indian Psychiatric Society. It's called The Science and Art of Yoga in Mental and Neurological Healthcare, trying to put all our studies together. Similarly, there has been quite a lot of Ayurveda work done. In a first national institute of national importance, we recruited Ayurveda faculty in 2019, and I am happy to say that in 2022 we started MD Manas Rog in NIMHANS in a modern biomedical hospital, and 2025 the first batch will come out. So a lot of work has been done in various disorders in the CCRAS NIMHANS collaboration over the years. Several publications have been done. Dr. Kishore, who published this paper, is the current head of the Department of Integrative Medicine at NIMHANS, is a MD Kai Chikitsa graduate. Many other people also have worked, done their PhDs, in that sense we have. So what we have tried to put together, provide integrated clinical services. What do I mean by that? It's not that yoga person in one room, Ayurveda person in one room, modern medicine person in one room. They sit together and they see the patient together. It's not that it's a practical model for everywhere, but what we are, the resident who is learning and presenting to these three people should learn from all the three people and be an integrative physician. So ultimately what we want to do is an integrated MD in psychiatry, which will be open to BAMS person, MBBS person to do an integrated MD in psychiatry. That's what we are ultimately planning to do. So this is our motto of the department, and the people who started, Professor D. Nagaraj, Professor Gangadhar, who was the former director of NIMHANS, currently the chairperson of the National Medical Commission, and Dr. Gauri Devi, who was a neurologist and a director. This is the current department. So we have also, of course, clinical services I have already spoken about. We have excellent yoga center. We have Panchakarma. I think we offer around 60 out of the total 75 whatever Panchakarma procedures. As you can see, this diagnosis cloud will show you what we handle. So schizophrenia, depression, of course, are the most important psychiatric disorders. Lumbar radiculopathy, spondylosis, Duchenne muscular dystrophy are the most important. Neurological diagnosis. Low backache, very big problem for our neurosurgeons. In fact, 2 heads of neurosurgery units came and told us, "Aap humko kuch karna padega." There 30 or 40% of the neurosurgery OPD is filled with low back people. And they can't operate, nor they can do anything else. And we have been actually taking them, and this is just an example. Within 2 weeks, a very significant reduction with Panchakarma and yoga treatment. Similarly, with schizophrenia, we have a very successful model for schizophrenia, and these are the courses that we are running: PhDs, MD, Manas Rog, MSc Yoga Therapy, and PDFs from both modern medicine side and the Ayurveda side. We have got enough and more funding for research, including the Center of Excellence from the Ayush. We have collaborated with a lot of institutions. So this is the opening of the Center for Excellence, what we call as the Yantra project. So here what we have taken is, we are trying to take 4 of the major disorders, 2 psychiatric, 2 neurological, and looking at genomics, neuroimaging, gut microbiome, and the immune parameters, trying to get into ultimately precision medicine, for whom what treatment will work. We publish around 50 papers a year, around approximately 500 citations a year, and very interestingly, all kinds of work, meta-analysis, systematic reviews, all the way down to commentaries, case reports, and most importantly, most publications are interdisciplinary. As you can see, psychiatry, probably yoga has much more importance, whereas for neurology, Ayurveda is probably more important. Most of our inpatients are neurology, who get a lot of the Ayurveda Panchakarma treatments. So why I have put all these slides, like I said in the beginning, I am not here to teach Ayurveda to any of you, but we really need to understand that for our population, this is the only way forward. We cannot reach 140 crore people using just one system of medicine. There are so many trained doctors, particularly in mental health, where medicines are not the ultimate answer. We need high quality research, and we all need to work together. What do we expect from the Ayurveda fraternity? We don't really expect just pharmacotherapy. We really need the ahara vihara part of it, which is not taught in the modern medicine system. My interest started in this whole thing because patients used to ask me when I wrote a medicine for them, patya kya karna hai? I don't know. Nobody has taught me what to eat, what not to eat, when to eat. That system is not there. Now that is what we really need from the Ayurveda and yoga side. Of course, pharmacotherapy also, Panchakarma. More importantly, the last 2 things are very important. We need to do hypothesis-based research with a scientific outlook, not just me doing my thing and you doing your thing. That won't work. We have to work together with confidence in our own system, right? That is what it is possible, eminently possible, as shown in NIMHANS. I think in the next 10 years, departments of integrative medicine will be there all across India, particularly in the AIIMS. It's going to happen, and we need to, gear up to work together for ultimately the benefit of the patient. I would end with acknowledgements to all our collaborators and the NIMHANS team. Thank you very much.
Thank you so much, sir. We are grateful that you shared your expertise and enthusiastically engaged our audience. Thank you, sir, for your time, effort, and expertise. We would now like to request chairperson, moderator, and coordinator to felicitate Dr. Shivram Varambali, sir, with certificate and memento. Please give a huge round of applause. Our second key speaker is Dr. Antonio Morendi, sir, who join us online shortly. There is an important announcement to make. Participants who are present here for paper presentation for the theme, Translational Research and Integrative Medicine, are requested to report to the Dhanvantri Hall in front of the main gate, main Pandal Hall. Dr. Antonio Morandi sir is the founder and director of Ayurvedic Point, Italy. He is the president of the Italian Scientific Society for Ayurvedic Medicine. Sir is awarded in 2003 with the doctorate Ayurveda Acharya. He is the head of medical education of the European Institute of Vedic Studies. We welcome you, sir, for Aroha 2024. Over to you, sir, for your deliberation.
Thank you. Can you hear me?
Yes, sir, you are audible. You can start your deliberation.
Okay, thank you. First of all, I want to thank Professor Tanuja Nezari for inviting me to this important event. And I apologize for not being able to attend in person, and thank you again for the opportunity to participate online. I greet all the colleagues and friends that are present, and especially Professor Shivaram Varamballi that actually I would have liked to meet in person. My talk will address on how it might be possible to use the principle of Ayurveda in the treatment of and the prevention of a mental problem, typically of modern society. If I can share my screen now. Okay. Oh, actually, I have to, for sharing screen, I have to start again. One moment.
Sir, permission is granted. You can start your deliberation.
Okay. Is okay? Are you? Can you see the slide?
Slides are visible, sir. You may start.
Okay, thank you. First of all, I want to bring homage and greetings to our teachers. Without them, none of us would be here. So we are facing a growing crisis about mental health, especially in the West. These are statistics that I'm showing about what is happening in the West. Depression affects 264 million people globally, WHO data. Anxiety disorder, 284 million. In the United States, out of 5 adults experience mental illness annually. So this is a real epidemic, is a real problem. These are some graphics that show the prevalence of depression and anxiety and the suicide rates that, as you've seen, is skyrocketing. And of course, this has also a huge impact from an economical point of view. I mean, the global cost of mental conditioning is going to be up to $6 trillion by 2030. So it is really an epidemic. And so it looks like that, prevention especially, but also cure is not able to to contain, to cope with this incredible escalation of mental disorders. But what are the causes of this? We can see, for example, that this is an average, the correlation of psychological condition with habits disorder. We know this very well in Ayurveda, how habits disorder can impact on the health in general, but especially on mental health. And we see that poor sleep, for example, is one of the most important correlation. Poor sleep is the disruption of circadian rhythms, which are one of the pillars of Ayurveda lifestyle. The Dinacharya teach us how to organize our life during the day and in such a way that we can live healthy. And if we go and see about the correlation with a habit disorder, with anxiety and depression, which are major, problems that are diffused in the population, we can still see that the poor sleep is one of the most important things. Of course, also the other sedentary behavior, unhealthy diet, screen time. And if we break down these data and we go and see what happened to people that do not have habit disorder, we can see that actually, there is a huge difference. So habit disorders are absolutely one of the main causes of mental distress. And this is this could be one of the first things that we can think about. Ayurveda can intervene very well in the prevention of this with the lifestyle, the Dinacharyas, Vastavrita, and so on. But actually, if we can make a kind of Ayurvedic analysis of all the causes that are bringing to mental health problem. And if we analyze the specific causes in modern society, in the modern manifestation, how the modern psychiatry call them, what is the Ayurvedic concept, we can see that we have a kind of Ayurvedic understanding, which is much more inclusive, but is in some way a little bit not well aligned with what is the modern manifestation. For example, we have specific causes in modern society: irregular daily routines, overstimulation from digital media, constant multitasking, lack of grounding practices, excessive travel, which they bring often to anxiety disorder, insomnia, attention deficit disorder, which are, for a Ayurvedic point of view, vata imbalance, and so on. Sedentary lifestyle, overconsumption of heavy processed food, the lack of mental and physical stimulation, oversleeping, irregular sleep patterns, and so on. The manifestation is chronic depression, lethargy, lack of motivation, which is maybe a kapha imbalance, or some kind of tamas imbalance more than kapha imbalance, or the artificial lightening, irregular meal times, they can bring to various mood disorders and sleep disorders. This is the disruption of the natural rhythm, accumulation of ama, which is correlated with poor digestion, environmental pollutants, and so on and so forth. We can go on. There are, for example, societal pressures, advertising, consumerism, disconnection from nature and natural instinct, over-reliance on external validation. These are the basis for the modern manifestation called addictive behavior and self-destructive patterns, which are nothing else than a form of prajnaparada, according to Ayurveda. Then, for citing another one, chronic stress, overwork, poor nutrition, lack of restful sleep, excessive sensory and or sexual indulgence. This is bring to weakened immunity, increased susceptibility to mental health issues, which is a depletion of ojas. So we can see that even if there is an understanding from an Ayurvedic point of view, this understanding from an Ayurvedic point of view does not match much with what is the modern manifestation. So there is a kind of difference. And of course, this we can see also from when we compare the therapeutical paradigm. The Western approach is more symptom focused. Instead, in Ayurveda, we have a root cause analysis. The Western approach has a standardized diagnosis, while in Ayurveda we have individualized assessment, Prakriti, Vikriti, Manasa Prakriti, and so on. Pharmaceutical intervention for the Western approach, lifestyle modification are favorite for Ayurvedic solution. Western approach separate very, very strongly mental and physical health, while the Ayurvedic solution integrate mind, body, and spirit approach. The Western approach has help you in manage the stress, while the Ayurvedic solution helps you to prevent the stress. So we can see that there is a quite difference between the two approaches. And this is reflected also in the modern psychiatric approaches, which are different from the Ayurvedic therapy. But this does not mean that they do not work. Modern psychiatric approach work and the Ayurvedic therapy work. The fact is that, as Professor Rambali was saying before, if we can use both of them, it will be better. But we have to find the way to merge these things, because it's not just to say integration, which is that it can be the solution, because we need to understand each other, not just to integrate, not just to use one technique in one system or in another system. All these differences, differences between the two systems, they create an epistemological black box. And this black box is the obstacle between the understanding of modern medicine and Ayurveda, and also the other traditional medicines, because this epistemological black box is seen as a miracle. I mean, this comic strip is very funny. The scientist, the head scientist, says to the assistant, "I think you should be more explicit here in step 2, because the step 2 is a miracle." So it's a black box. It's something that in which something enters inside, is elaborated, and outside comes out the solution. But we don't know what is happening inside. And despite the growing body of evidence supporting the efficacy of traditional medicine like Ayurveda, there is a significant barrier to their acceptance within the modern medical community, and this barrier is not it's not about the results, but about the understanding and explaining these results within the contemporary scientific paradigm. Modern medicine is rooted in a specific epistemological framework that, and this framework demands the understanding of the mechanism of action behind any treatment before fully accepting its validity, which is in principle a sound scientific approach, but it presents a unique challenge when we deal with traditional medical systems like Ayurveda, which operate fundamentally on a different epistemological foundation. The mechanism of action of Ayurvedic treatments and Ayurvedic pharmacology and Ayurvedic therapy is intrinsically linked to concepts such as dosha, guna, and the subtle interplay that there is between elemental energies, between body and minds. This concept, while coherent and sophisticated within the Ayurvedic framework, do not easily translate into the language of neurotransmitters, neuroreceptor sites, biochemical pathways, which are typical of modern medicine. So this is a very important thing. This is the main challenge. The main challenge that prevent us to use the both of the system at their optimal level for the benefit of mankind. Traditional medicine shows results, but lacks acceptance due to an unexplained mechanism. Because a true integration requires understanding, not just evaluation. It's not just data. We have to understand each other. And for this, we are proposing, and we will propose this in the framework of mental health, the concept of collaborative medicine and science, which is an innovative framework designed to bridge the epistemological gap between traditional medicine systems, particularly Ayurveda, and modern biomedicine. As I explained many other times, there are three main steps: reformulation of Ayurveda epistemology, modeling of Ayurveda, localization of Ayurveda. This is a model that can be applied to any traditional medicine, but in this moment we are speaking about Ayurveda. This is the framework that will allow to make an interface between Ayurveda and modern medicine, and this will lead to expanded understanding, integrated approach, and comprehensive care. And this is very important because otherwise there is the risk that Ayurveda is bended to satisfy modern medicine, or modern medicine refuse Ayurveda because it's not understood. While we have to maintain the integrity of the epistemology of Ayurveda and to interface this epistemology with the epistemology of modern medicine. Because this approach allows us not to demonstrate only that Ayurveda system is working, but we don't have the need of this, but why they work, and in a way that satisfies the epistemological requirement from modern medicine. We have to create a common language between the two systems that link traditional and modern practitioners and put them able to understand each other. So we have this challenge, and the root cause of this challenge is, as we said, the epistemological differences between traditional and modern medicine. In this situation, if we apply the COM solution that bridge diverse knowledge systems without reducing one to the other, through the process of reformulation, modeling, and localization. Reformulation translate concepts across paradigms. Modeling create testable models integrating both perspectives. Localization adapt understanding to specific contexts. We can have the outcome that explain how and why of traditional treatments in modern terms, expands conceptual framework of modern medicine, and facilitate development of truly integrative approach. Because we don't have to think that this system not only give the possibility of the two systems to speak together, but it may expand the conceptual framework of modern medicine. Because while Ayurveda is inclusive in the view of nature, modern medicine is exclusive, that create this kind of difference between an inclusive model and a reductionist model, which is typical of modern medicine. So this system, this COMS, doesn't just integrate treatments, but integrates the way of knowing. So, how these COMS can be applied to mental health? We can create, the first phase is reformulation and contextualization. We can create a common conceptual space. We can explore Ayurvedic concepts like manas, sattva, rajas, and tamas in relation to modern psychological theories. We can reframe modern diagnostic categories through Ayurvedic perspective, not the opposite. We have to develop new vocabulary that bridge Ayurvedic and modern understanding of mental health. to in the phase of modeling that bridges the epistemologies through models and artificial intelligence also, we can develop artificial intelligence mathematical models of the Mahaguna, for example, and Tridosha systems as it relates to mental states. We can create artificial intelligence simulation of Ayurvedic interventions for mental health. We can design experimental setups that can measure Ayurvedic concepts like Agni or Ama in relation to mental health parameters. And finally, when we speak about Ayurveda localization, the third phase, and it means to adapt Ayurveda to local context, we can identify, for example, local herbs with properties similar to traditional Ayurvedic psychotropic herbs, but which are more linked to the ecosystem in which a patient is living, adapting Ayurvedic daily routines, dinacharya, to fit Western lifestyles, for example, for the West, while maintaining their mental health benefits, integrating Ayurvedic concept of mental health into existing Western mental health services and public health initiatives. All of these will have a lot of implication for mental health care, because this will bring to a more personalized treatment approaches based on individual prakriti and modern biomarkers. There will be the integration of Ayurvedic preventive strategies into public mental health initiatives. There will be the development of new integrative therapies that combine strengths of Ayurvedic and modern approaches together. And there will be the possibility of a shift towards a more holistic system-based understanding of mental health and illness, a comprehensive model of understanding mental function. Just to make two examples, this is just a draft, of course, but just to let you understand what is the basic idea of collaborative medicine and science, we can see how it can be the approach to depression. The reformulation could be the reframe depression, not just a neurotransmitter imbalance, but a systemic issue involving mind-body environment interactions, aligning with Ayurvedic perspectives. About modeling, develop a model that integrates Ayurvedic concepts like guna and doshic imbalance with modern biomarkers of depression. The localization, we can adapt traditional Ayurvedic therapies for depression using locally available resources and culturally appropriate practices. This is just a draft of something that could be developed, could be exploited. For anxiety, the reformulation contextualize anxiety within Ayurvedic understanding of Vata imbalance and modern neurobiological findings, for example. Modeling create a computational model that predicts anxiety levels based on both Ayurvedic, Prakriti and Vikriti, and modern cortisol levels, heart rate variability parameters. The localization develop anxiety management programs that integrate Ayurvedic practices with modern cognitive behavioral techniques tailored to local cultural context. This, of course, this system, this proposal has challenges. Has challenges because this proposal is not just can apply one technique, but is to reframe a way of thinking. So we have to develop rigorous methodologies for translating between Ayurvedic and modern concepts. We have to train healthcare professionals in integrative approach according to this kind of model, not just to tell to a modern doctor that he can use yoga or telling to an Ayurvedic doctor that there is the cortisol. This is not the way, but to understand the epistemology of one system and to compare the epistemology of the other system, understand how the two systems work, what are the commonalities, because it's only through the commonalities that we can interface these two systems, not looking at the difference, looking at the commonalities. And then, of course, there is the addressing regulatory and standardized issues in integrative mental care, which is a challenge, of course. But we have some, of course, possible strategical implementation, which are the direction that could be followed if we start following this kind of approach of the collaborative medicine and science. Of course, it has to be a collaborative research design. So for doing this, we have to have interdisciplinary teams. Interdisciplinary teams that speak one each other at the same level with open mind and a lot of, humbleness. Without humbleness, nothing happens. If one thinks that is better than the other, we are lost completely. Of course, we have to develop new outcome measures that capture both symptomatic improvement and overall well-being, which are the two, the two marks of the two systems of knowledge. We have to design clinical trials that can account for individualized Ayurvedic treatment within standardized protocol, and this is possible. We have demonstrated this a few years ago with the Charité on the study that we have done on the osteoarthritis of the knee. So these we have published also on trials, journal very important about clinical design. So we can design new clinical trials. And we can utilize artificial intelligence, system biology, and complex system approaches to understand the complex effect of Ayurvedic intervention of mental health. And finally, we can imagine large-scale clinical trials of collaborative medicine and science-based intervention for mental health. Of course, as I said before, it's not just the application of one technique, but is a new way of thinking. So we have to reframe the way we think, the way the new doctor, the doctor of the next generation will think. So we have to develop integrative mental health curricula for medical education, which are not just to say that cortisol exists or that there is, dinacharya, but to make one understand what is the meaning in a inclusive, ample, extensive vision of the reality. And with this, and of course, creation of policy frameworks to support the integration of traditional and modern approaches in mental care. And with this, I thank you very much.
Thank you so much, sir. We appreciate your dedication to your field and your willingness to share your expertise with us. Thank you so much, sir, again, for your valuable contribution.
Thank you to all of you, and I hope to see all of you in person very soon.
Thank you, sir.
Bye-bye.
So before moving ahead, let me introduce you to our distinguished chairperson for this session. The first chairperson is Professor Dr. Khandel, sir. Sir is a retired professor from NIA with more than 35 years of teaching experience and currently serving as a consultant at Arogya Lakshmi Healthcare, Jaipur. He has done his WHO fellowship in Mental Healthcare Victorian Transcultural Psychiatry Unit, Royal Melbourne University, Australia. Sir has received an award for GEM Fellow of the National Academy of Ayurveda, RAV, Ministry of Ayush. Sir has also published more than 77 research papers in journals of high repute in a medical science. Moving on to our next chairperson, we are honored to introduce Dr. Praveet, sir. He is appointed as a director in WHO Collaborating Center for Traditional Medicine in 2018 at Faculty of Medicine, Siriraj Hospital, Mahidol University, Thailand. He is currently the Metabolomics Group Leader in Thai Traditional Medicine at Siriraj Hospital. He is also pioneering the development of an AI platform for Thai Traditional Medicine. We welcome you, sir, for Aroha 2024. Sir, join. So without further delay, let us dive into our promising schedule for oral paper presentation. For that, I would like to call Dr. Ravikant Sharma, sir. Over to you, sir.
Hello. Om Dhanvantraya Namaha. Thank you, Dr. Sweta. Good afternoon, respected chairperson, moderator, coordinator, rapporteur, and dear participants. I, Vaidya Ravikant Sharma, PhD scholar, again welcome you all in AROHA 2024 paper presentation session 6. The theme of this session is Ayurveda for the management and promotion of mental health. Before moving ahead, let me briefly go over the guidelines for the presentation. Each participants will have 5+1 minutes to complete their presentation. After 5 minutes, a bell will ring, signaling the need to conclude within the final minutes. You will be judged based on few parameters, which are organized content, clarity of presentation, use of visual aids, timely completion, and response to the question. Now I want to ask the permission to the chairperson. Sir, should we call our first presenter? Our first presenter for the session is Dr. Khushi Tyagi.
A very good morning to one and all present here. My name is Khushi Tyagi and I am a final year UG student from GS Ayurveda Medical College. And today I am here to present my topic, Rhythm Investments. Quite tricky, right? We'll understand the topic as we proceed into the presentation. But before that, I would like to thank my guide, Vaidya Shubham Garg sir, for his guidance. Before going further, let me ask a question to everybody. How many times have you experienced a chaotic mind with lots of thoughts and you didn't even have anything to think about and had no clarity about what to do, which hampers productivity? Okay, has anybody experienced that chaotic mind once a month? Anybody once in a week? Anybody twice a day? Yes, I am among them. And now that is stress. As sir mentioned, tension repeated endlessly. Now talking about stress, millions are affected worldwide. It affects our relationships, our productivity, not only in our workspaces, but in our day-to-day life. It not only affects our mental health, but also affects our physical health. And trust me when I say, बाल tension से ज़्यादा झड़ते हैं. Now when we talk about solution, a lot of people dwell on medication. And these medications a lot many times are ineffective, addictive, and have a lot of side effects. When we talk about solution, now these stress levels demand urgent attention, for which we need holistic approaches to relieve stress, anxiety, depression, and related symptoms. This has created a gap, which is need for affordable, effective solutions, which gives opportunities for innovative and scalable solutions. Second, there is a rising demand for natural remedies. Now, when I tell all of you that you can meditate and get relief from stress,
I think a lot of us will take a lot many time to just decide that when can we start meditation. But if I stand here and tell you that there will be a joyful integrated music therapy which will be fun to take, I think we all would love to take it. Now, before going to the therapy, let us talk about prevalence of stress. Now, according to various data that I have collected, workspace stress is 79%. The stress in healthcare workers is 43%, 26% adolescents, 45% students, and 36% general people of all ages are affected from stress, symptoms of stress, anxiety disorders, and insomnia. Now, talking about solution, my journey, your healing, the unveiling of prana rhythm therapy. For this, I would like to thank my guide in my research project, Dr. Atul Charokte sir, for guiding me and supporting me throughout. This is an integrated therapy of flute music with transcendental meditation. I have done this research under Spark project by CCRAS. The study setting was GS Ayurveda Medical College. Now, telling about the therapy, this is a guided Bij Mantra therapy which was given to Ayurveda students for 30 days, and there were 4 different groups. The references that I have taken, the Bij Mantras from Transcendental Meditation, and the references for flute music are Srimad Bhagavatam, chapter number 21, volume 10, shloka number 6, 10th and 14th. Now the study type was open label randomized clinical study. The study design was pre-post test design. There were 4 different groups. Group 1 was giving guided Bij Mantra. Group 2 was giving flute music therapy, which was changed according to different frequencies of the music every week. Group 3 was given the integrated therapy, and group 4 was the controlled group. Now, these are the results of my therapy. Group first, which was guided Bij Mantra, showed a change of 20%. Group 2 had flute music, and there was a change of 18%. And group 3, the integrated prana rhythm therapy, showed a remarkable result of decrease in stress levels by 38.2%. Now, as I got this solution and I thought that this can be really usable and affordable to everybody, I thought why not to give it to everybody. So this is how I assessed the market and extension plan. So we will be assessing identification, the high stress sectors. We will be providing this therapy by multi-center on-site service model, strategic integration with healthcare ecosystems and corporate organizations. This therapy session will be given for 7 days by trained therapists. Pre and post assessment will be done. To drive expansion, we will leverage social media, influencer marketing, and content creation. Now, scope and dimensions. The workplace stress market is valued at 10.9 billion in 2023. Global stress management market expected to grow 16.7 billion by 2033. Global music therapy market is 2.62 billion in 2023, which can leverage to 5.73 billion. Now, these are the projections that I aim to serve 20,000 people in next 6 months with just 1,000 per person for a session of 7 days. Lastly, let us give prana rhythm a chance to take our mind from chaos to the beautiful world. Thank you so much.
Thank you, Dr. Khushi. Next we have Dr. Anaga.
Namaste everyone. I am Dr. Anakha Shivanandan, Assistant Professor, Department of Prasuti Tantra and Stri Roga, Muralidhar Ayurveda College, Rajkot, Gujarat. Let me present before you some of my research findings on the topic Customized Music Interventions Based on Ayurvedic Principles, a Gateway to Novel Research Avenues. So in my presentation, I will be dealing with first a brief background of my study topic, and secondly, the scope of integration of Ayurveda with Indian musicology, and the theoretical background for my research topic. And thirdly, the key elements which help us to customize a particular music to a particular disease condition or the status of health, and how I have implied it in my research work with an example. And fourth, the observations and results which I have got in my research with a customized music intervention along with the Ayurvedic Rasayana therapy in perimenopausal women for the management of menopausal symptoms. So the music and mental health, there are ample of research works being published regarding the role of music in mental health nowadays, and the recently published WHO Scoping Review has categorized the music activity for promotion of mental health and well-being into mainly 3 categories, which includes receptive music listening, intentional music listening, music with movements, playing of musical instruments, like that. So in our Ayurveda, we have a direct reference regarding the role of Shabda or the music for the management of mental disorders. Manasanam tu Shabdadi Rishto Vargaha Sukhavaha. So being an Ayurveda scholar and also a student of music, I have a special interest to explore the scope of Indian musicology and integration with Ayurveda. So first of all, we can see both these streams, Ayurveda and Indian musicology, have a same root in our ancient Indian philosophy. The principles like the Srishti Utpatti, or the origin of universe, and the concept of Triguna, Panchamahabhuta, all are same in both the streams. So this is the main basis of integration of these 2 streams, and there are mutually complementing references available in both the streams. In Ayurveda classical texts, we have the references regarding the therapeutic utility of music, as well as in the textbooks of musicology, there are a lot of references which says the relationship between the musical notes, swara with tridosha, and the rhythm patterns and their ability to induce a particular aesthetic taste. And there are references regarding the properties of swara correlated with the shadrasa, properties of shadrasa. So these all are the basis for integration of these 2 streams. And these are the key factors which I have identified, which will help us to customize the music according to a particular condition based on Ayurveda principle. Both the melodic components as well as the rhythmic components are equally important. In melodic component, swara, that is the musical notes which have a particular relation with the tridosha, and the shruti or sthai, what we call the octaves in the piano, which relates with the pitch of that particular note, that also should be considered. And for a framework of a melody, we should consider the raga concept and the emphatic notes in a particular raga, which is having a particular frequency. That also we have to take care. And in thala, we should specify the thala patterns, which pattern we have to select for that condition, and which laya, which speed or tempo of that melody, that also should be customized. And the concept of frequencies or the resonant frequencies are applicable in customizing the music, because there are researches regarding the natural frequencies of body organs, and if we give a music into that particular frequency, that can have a particular effect on that particular condition. And there are references regarding the use of different type of musical instruments and their special affinity to the body parts. So this is the example what I have made for a music I have composed for treating the menopausal symptoms. So in menopause, if we see in Ayurvedic concepts, it is a process of jara, where the dhatukshaya is happening, vata vriddhi is happening, which leads to altered functions of pitta also, and there is a decreased state of kapha. So we have to, the desired effect is that vata anulomana, pitta shamana, and kapha promoting effect. So based on that, it is the music was formulated. And in clinical trial of menopausal, perimenopausal women, we have selected 100 women and divided into 2 groups. In first group, an integrative therapy was given with Rasayana therapy along with this customized music, and in second group only Rasayana therapy was given. And the results and observation were very promising, that the integrated protocol is having a great significant difference between the control group. So it was reflected in the score of menopause specific quality of life scale, Hamilton anxiety rating scale, and Hamilton depression rating scale, and also the grading of Manasika Bhava. And we have given a receptive music therapy in which the patients are not having a role in the selection of music. They are just want to passive listening to the music. But the accept like Manasa Prakriti, musical attitude, musical preference, and these all are interrelated, but these factors didn't affect the effect of therapy. So the receptive music listening is a very effective protocol or the method. So in conclusion, Indian musicology is having great scope for integration with Ayurvedic principles and its therapeutic application, especially in the psychological domain of the health. And the customization of music requires proficiency in both the principles of Ayurveda and musicology. And the receptive music listening is a feasible and effective method for implementing the customized music interventions based on Ayurveda principles in integrative treatment protocols. Thank you.
Thank you. Our next presenter is Dr. Sonam. Participants, please note regarding the time of completion of your presentation.
Namaste. Namaste. Good afternoon to respected teachers and all the participants present over here. Myself, Dr. Sonam, PhD scholar, Department of Ayurveda, presenting topic, is screen time really associated with adolescent mental health? Findings from a cross-sectional study under the guidance of Dr. Mahapatra Arun Kumar sir and Dr. Rajagopala sir. As we all know that mental health is very important in all aspects of individual's life, and it has been mentioned as one of the Sustainable Development Goals 3.4 to reduce the premature morbidity and mortality up to more than 50% by 2030. And adolescents encountering repeat changes in various domains, physical, mental, as well as social as well. So as per the WHO data, the 10 to 20% of adolescents are responsible for global burden of disease and injury. And it has been observed that majority of the mental health conditions start by the age of 14 years, but they remain unnoticed and undetected. And there have been an increase in about 4 million adolescents during last 2 decades. And about screen time adolescents, as we know that we are going through an era of technologies, modern instruments and other. Thus, the current generation of children and adolescents are being exposed to electronic devices from an early age. Thus, WHO has defined screen time as a time spent passively watching or engaging with visual screen-based technologies and excluding the activities like talking on phone or listening to music. The global, among all mental health conditions, depression and anxiety is the most prevalent and becoming the leading cause of illness and disability. And according to National Mental Health Survey of India, depressive episodes and anxiety disorders among adolescents are approximately 2.6% and 1.3% respectively. These are the global prevalence of depression and anxiety and the screen time of more than 2 hours per day across the countries. As per the WHO recommendations of 2019, the children below the 2 years of age should not be get exposed to the screens, and the children between 2 to 5 years should be have a screen time of maximum of 1 hour per day, monitored under their caregivers. And adolescent and adults should not having the more than 2 hours of screen time per day, and should be having at least an average of 60 minutes of moderate to vigorous intensity physical activity. So considering all these factors, mental health and the prolonged screen time, the public health is becoming a public health concern due to their growing prevalence and negative consequences, and at its severe suicidal thoughts and behavior are its outcomes. And this burden has been increased by the 52% during the COVID-19 epidemic. Thus, a cross-sectional study was conducted between the age group of 10 to 19 years among 785 participants of School of South Delhi. And after taking informed consent, a self-reported questionnaire was administered having socio-demographic variables and questions on physical activity and questions on screen time. Along with the patient health questionnaire was administered. Analysis was done on descriptive statistics was applied for socio-demographic variables, and chi-square was done on the to found the association. Sample size was calculated on the basis of previous study. The study was ethically approved by IEC Committee of AIIA. This is the study enrollment chart, and total 785 survey performers were finalized for the analysis. As per the socio-demographic variables in the present survey, the majority of the participants were belong to 13 to 15 years of age group, having mean age of 13.5 years. Majority of the participants were male and belongs to upper middle socioeconomic status. As per the status of anxiety, 14% of the participants were found positive for anxiety, and 26 participants were found positive for depression. The overall distribution of the participants was on the basis of severity. Mild to moderate were 191 and 75 respectively, and only 19 participants were found severe for mental health condition. And as per the parents' education, the significant association was found between education of the parents and depression. As per the screen time, the majority of as per the average screen time, the participants having more than 2 hours per day were found positive for depression, and the participants having inadequate physical exercise were found positive for depression. As per the screen time based on the gender, the majority of the male have been found positive for average screen time, and as per the physical exercise, males are found more positive for depression, having less physical exercise and less average study duration. Other associated factors for anxiety and depression are late adolescent, higher secondary grades, unsatisfactory sleep, addiction, and common risk factors for both anxiety and depression are secondary grades, increased age, and unsatisfactory sleep. As per the considering the mental health of the adolescent, we can prevent the adulthood illness, increased risk of injuries, substance abuse, and may improve the quality of life, socioeconomic development, and can provide the triple dividend health benefit to the nation. Thus, further longitudinal multicentric studies may be conducted to evaluate the other associated factors, and early intervention and integrated approach may be applied. Thank you. These are the references and some glimpse of the survey study conducted at Schools of South Delhi. Thank you.
Thank you, Dr. Sonam. Next, we have Dr. Swangil Srivastav.
Good afternoon, everyone. Myself, Swangil Srivastav. I am a UG student of Shivalik Institute of Ayurveda and Research. Today, I will be presenting on Ayurveda for mental health, a holistic approach. First of all, to discuss about this, we should know what are the incidence rates that are happening worldwide over the mental health disorders. According to a WHO study done in 2019, 1 in 8 people worldwide live with a mental disorders. Now, अब इसमें दिक्कत क्या आती है कि इसका ट्रीटमेंट तो मॉडर्न मेडिसिन अकॉर्डिंगली करता है, लेकिन उसमें भी लिमिटेशंस बहुत ज़्यादा होती हैं. फॉर एग्जांपल उस मेडिकेशन के साइड इफ़ेक्ट्स बहुत ज़्यादा होते हैं, एडिक्शन पोटेंशियल्स होता है उस मेडिकेशन का. अगर कोई मेडिसिन एक बार शुरू कर दे तो उसमें उस मेडिसिन के रिगार्डिंग एडिक्शन पोटेंशियल जनरेट होना शुरू हो जाता है. फिर मॉडर्न कन्वेंशनल ट्रीटमेंट के पास रूट कॉज का लिमिटेड एक्सेस है. अब इसमें आयुर्वेदा कैसे हेल्प कर सकता है? फर्स्ट ऑफ ऑल, आयुर्वेदा फोकसेस ऑन द Ayurveda is all about mind, body and spirit connection. Both are equally connected and well balanced. Then focus on balancing of the 3 doshas. A success story. Now according to a study conducted by Bashavraj R. Chubaki and his team in 2021, a following was observed in a patient. एक पेशेंट था जिनके अंदर सिम्टम्स थे सैडनेस, वर्थलेसनेस और अदर मेजर डिप्रेसिव सिम्टम्स रिगार्डिंग एज पर मेजर डिप्रेसिव डिसऑर्डर्स एज पर DSM-5 क्राइटेरिया. अकॉर्डिंग टू आयुर्वेदा, हर डायग्नोसिस वाज मेड एज कफज उन्माद. Following is the criteria that were met and the diagnosis according Ayurveda and modern were correlated. Next, after that, the treatment plan were followed by first of all Panchkarma treatments and then of herbal formulations and counseling and religious. As per in Ayurveda, Acharya Charak has said the treatment of mental illness has to be done on the 3 bases. First of all, Deva Vipasya Chikitsa, second Yukti Vipasya Chikitsa, and third one is Sattva Vajay Chikitsa. Both the three of them were followed in this case study. Treatment plants like Snehapan, Virechar and Shirodhara with Ayurvedic medicinal oils such as Brahmi Grit were prescribed. Herbal formulations of drugs such as Ashwagandha, Brahmi, Shatavari and Manduk Parni with a combination of Manjista, Adhikat, etc. were prescribed. Then after that, counseling, Sattva Vajay Chikitsa based counseling was done, and then Devi Vipasya Chikitsa religious counseling was done on the patients. Now positive outcomes and remissions were included that symptom reductions, जो symptoms थे उस patient के अंदर वो drastically reduce कर गए according to HAMD scale. Decrease from 1794 to 6.08 after the treatment. Complete remission within 180 days of treatment. The patient achieves complete remissions of their depressive symptoms, and after that sustained recovery was remain stable during the follow-up period, indicating sustained recovery. अब कुछ ड्रग्स हैं जैसे कि अश्वगंधा हो गया, शतावरी हो गया, ये बहुत ही अच्छे वर्क्स हैं इनके with respect to mental health. For example, अश्वगंधा में आपका सिटोइंडोसाइड्स होता है, विटाफेरिन होता है, ग्लाइकोविथेनॉइड्स होता है जो कि स्ट्रेस रिड्यूसिंग एक्टिविटी शो करता है, एंजाइटी पे एक्शन करता है, कॉर्टिसोल लेवल्स डिक्रीज करता है. ये सारी की सारी स्टडीज़ हुई हैं जो कि बहुत ही माइलस्टोन प्रूव होती हैं. फिर नेक्स्ट कम टू शतावरी. शतावरी हैज़ एस्पिरेगिनिन, शतावरीन एंड सैपोनिन्स विच बैलेंसेस द हार्मोन्स एंड रिलीव स्ट्रेस, promote relaxation. Next is Brahmi. Brahmi has bacosides, brahminine, which enhances memory and improves the cognitive function. The next one is Manduk Parni. Manduk Parni has tripenoids, acetylglycosides, which helps in reducing anxiety and promotes sleep and improve moods. Now we come to the point where how Ayurveda can help us. First of all, Ayurveda can help us in providing treatment based on dosha balance, digestive health and mental clarity. दोषा बैलेंस कैसे? हमारी बॉडी आयुर्वेद के अकॉर्डिंग 3 दोषों पे बनी है. अगर दोष हमारे बैलेंस रहेंगे तो हमारी बॉडी में सारी एक्टिविटीज़ प्रॉपर होंगी. डाइजेस्टिव हेल्थ, अग्नि अगर हमारी सही है तो हमें हमारे शरीर में आम नहीं बनेगा. इम्प्योरिटीज़ नहीं वो कोगुलेट होंगी और फिर हमें कोई प्रॉब्लम्स नहीं होंगी. मेंटल क्लैरिटी, प्रॉपर न्यूट्रिशन इज एसेंशियल फॉर ऑप्टिमल ब्रेन फंक्शन एंड मेंटल क्लैरिटी. एडिशनल बेबी स्टेप्स हम क्या परफॉर्म कर सकते हैं? स्ट्रेस रिडक्शन सच एज योगा, मेडिटेशन एंड प्राणायाम हेल्प रिड्यूस स्ट्रेस. फिर माइंड बॉडी कनेक्शन, foster a deeper connection between the mind and body, enhancing self-awareness and inner peace. Energy balance, regular practices of yoga, meditation and pranayam helps balance energy levels and improve vitality. Improve focus, so enhances concentration, focus and mental clarity. Now to conclude this, the power of Ayurveda is how we can achieve this in mental health treatment disorders. First of all, holistic approach. Ayurveda addresses mental health by considering the interconnectedness of mind, body and spirit. With as अगर mind, body और spirit एक दूसरे से interconnectedness है तो उसमें treatment basis भी उसी हिसाब से होनी चाहिए. Personalized treatment, हर व्यक्ति का प्रकृति अलग होता है, हर व्यक्ति की दोष प्रधानता अलग होती है, तो उसके बेसिस पे भी हम पर्सनलाइज्ड आयुर्वेद के थ्रू पर्सनलाइज्ड ट्रीटमेंट दे सकते हैं. Effective for various conditions, Ayurveda can be beneficial for a wide range of mental health disorders including anxiety and depression and stress. Improved quality of life, Ayurveda treatment can help individuals experience a greater sense of peace, balance and overall well-being. Thank you.
Thank you, Dr. Swangil. Next we have Dr. Satabdi Pati.
Namaste, respected dignitaries, teachers and one and all present here. Today I am here to present a case report, that is efficacy of Manasadi Ghan and cognitive behavioral therapy in Bishad, that is adolescent depression. Adolescent depression is characterized by persistent low mood, anhedonia and significant impairment in daily functioning and feeling guilty, disturbed sleep and low power of concentration. At its worst, it can lead to suicide. Globally, it is estimated that 1 in 7 10 to 9 years old experience mental health condition, yet these remain largely unrecognized and untreated. According to National Mental Health Survey of India, the prevalence of mental disorder is 7.3%. In adolescent depression, the prevalence ratio of female to male is 2:1, indicating a higher incidence among female. Conventional antidepressant medications are frequently associated with adverse effects. This study investigates the efficacy of Manasadi Ghan as a viable alternative for the management of Bishad, that is depression. In Ayurveda, Bishad can be correlated with depression on the basis of its sign and symptom. Asiddha Bhayat Vivideshu Karmeshu Shada Prabhuti Vishada. Acharya Dalhan defines Bishad as a condition originated from apprehension of failure resulting into incapability of mind and body to function properly. Here the patient is 16 years female, resident of Badarpur, first reported to Komarbitya OPD on 21 January 2024, having chief complaint, hopelessness, little interest in doing things and trouble in concentrating things since 15 to 20 days. After taking history, it was found patient was apparently well before December 2023. Due to academic stress, gradually she started feeling hopeless. After screening with the help of PHQ-9 scale, patient was diagnosed with moderate depressive disorder and further management was done. No such past medical history found. Birth history is non-significant and family history is not significant. Patient is having a moderate build with height 162 cm, weight 48 kg, with BMI 18.29 kg per meter square. In personal history, there is reduced appetite, sound sleep, bowel and maturation habit is normal, and no such allergic condition found. In clinical findings, no systematic abnormalities detected during CVS and respiratory examination. Patient is well conscious, well oriented, memory is intact and with normal speech. This is Ashtavidha and Dasavidha Pariksha. Patient having Vata Pitta Prakriti with Avara Sattva. Diagnostic assessment was done using scale PHQ-9 and PSQI. Before treatment, PHQ-9 score is 12, that is in moderate depression, and PSQI scale is 6. Treatment CBT given with oral administration of Manasadi Ghan capsule in a dose of 500 mg into equal divided dose. Anupan is lukewarm water. duration is 8 weeks with CBT in every week, and post duration is 8 weeks with CBT in every week. After treatment, PHQ-9 score reduced to age, and at follow-up it reduced to 6. PSQI scale reduced to 4 at after treatment and follow-up. Discussion: symptoms were improved significantly, and during the follow-up period, no occurrence of symptoms. Adolescent depression is caused due to academic stress, lack of family support, self-centered, moderate self-esteem, and family issue. According to Acharya Charak, Bhaya correlates with presence of Vishad, resulting into inability of mind and body to function appropriately, that is Bhayam Vishadena. And Vishad exaggerates symptoms of various illness and indicating a relationship between immunity and Vishad, which is Vishada Rogavardhanana. Probable mode of action of Mamsadikvatghan. It consists of 3 ingredients: Ashwagandha, Yatamansi, and Parshikavani. Ashwagandha having Vatasamaka property due to Madhura Rasa, Madhura Vipak, and Usnavirya and Snigdha Guna. Yatamansi due to Madhura Rasa and Snigdha Guna pacify Vata. Parshikavani due to Usnavirya pacify Vata. The ethanol extract of 3 dogs shows neuroprotective effect, sedative effect, and cognitive benefits, and 3 drugs combinedly act on Vishad. Ashwagandha acts on cortisol receptor and GABA receptor, and Jatamansi acts on GABA receptor and serotonin receptor, that is regulation of serotonin and dopamine. Parshikavani acts on blockage of methanic receptor and anticholinergic. Combinedly, 3 drugs have neurological effects such as neurotransmitter modulation, neuroprotective effect, antioxidant effect, sedative effect, and cognitive benefits. Probable mode of action of CBT. CBT acts on negative thoughts, negative emotions, and unhelpful behavior, and it is replaced with balanced positive emotion and adaptive behavior. In Ayurveda, Sattva Chikitsa is compared with cognitive behavioral therapy. By strengthening the mind and controlling the mind, enhance Sattva Guna, reducing influence of Raja Tama, redirecting negative thoughts to positive thinking by meditation and mindfulness, yoga and pranayam, spiritual practice, mantras, prayers, cognitive restraint, self-discipline, and emotional detachment. Due to this therapy, mental balance and emotional stability occurs and reduce negative emotion. Conclusion: the combination of Mamsadikvatghan and cognitive behavioral therapy resulted in notable improvement in both depressive symptoms and sleep quality. In this case, the integrative approach demonstrates the potential for combining traditional Ayurvedic treatment with modern therapies, providing a comprehensive option for managing adolescent depression. All problems are the illusion of the mind. Thank you.
Thank you, Dr. Satabdi. Next we have Dr. Swati Verma.
Good afternoon, one and all present over here. Myself, Dr. Swati. I'm here to present my topic, Bridging Ayurveda, Manas Prakriti and Modern Personality Psychology, Correlations with the Neo 5-Factor Inventory, under the guidance of my guide, respected Dr. Meeraki Bhajani ma'am. So we know contemporary personality psychology is dominated by the trait-based models, primarily the 5-factor models, which contains 5 domains, and is for neuroticism, that is the domain responsible for emotional instability. E is extraversion, depicting the domain of sociability. Openness, for openness to new experiences. A is for agreeableness, that is the domain of interpersonal relationships, and conscientiousness is the domain of responsibility or dependability. So in the recent years, we have witnessed a paradigm shift towards the cross-cultural personality assessment. Manas Prakriti reveals a developmental hierarchy of an individual psyche ranging between incognizant Vanaspati state to the omniscient Brahma state. It integrates the mental and physical aspects of personality, thereby broadening the potential to enrich global understanding of personality traits. Now, why do we need cross-cultural research? It enhances our understanding of human diversity and informs more culturally sensitive psychological interventions. So, material and methods. Study design has been cross-sectional correlational study with a sample size of 300. Stratified random sampling was used, and healthy individuals with aged between 25 to 60 years were included, and current psychiatric disorders and cognitive impairments, they were excluded. Assessment tools used were validated Manas Prakriti assessment tool that assesses an individual's Sattva, Rajas, Tamas temperaments as well as Shodash Manas Prakriti levels. The Neo 5-Factor Inventory and GHQ12. The GHQ12 is used for assessing psychological distress, the level of psychological distress. Then methodology was like that after due IAC clearance from the institute ethical committee, participants they were enrolled and they completed Neo FFI GHQ12, and MPAT was administered at a gap of 2 days. Then coming to results, when we look into Sattva Prakriti types, there was a generalized negative correlation with neuroticism domain and positive correlations with conscientiousness domain, with Pearson correlation coefficient values ranging from -0.18 to -0.20 and 0.15 to 0.20 respectively for both the domains. And some prominent correlations were seen in Brahma Sattva and Arsha Sattva as shown. In Rajas Prakriti types, positive correlations with neuroticism and negative correlations with conscientiousness with their respective coefficient values of 0.07 to 0.14, and conscientiousness ranged from -0.7 to -0.15. Then when we come to Tamas Prakriti type, then a similar trend as the Rajasic Prakriti type was noticed here also. And analyzing the results of MPAT and GHQ12 correlations, the Sattva Prakriti individuals, they showed a weaker correlation with the GHQ12 scores, and Rajas and Tamas had a weaker positive correlations with GHQ12 scores. Now coming to discussion, the negative correlation with neuroticism in the Brahma Prakriti, it aligns well with the emotional stability, that is Kam, Krodh, Lobh, Man, Moho, Irsha, Harsh, Amar, Shapetam, Samam, Sarv, Bhuteshu, as quoted by Acharya Charak, indicating low impulsiveness and anxiety, whereas the positive correlation with conscientiousness is reflected well with the attributes of Gyan, Vigyan, Vachan, Prativachan, Sampannam. It highlights the competence and self-discipline facets of conscientiousness domain. And Arsha Prakriti, the positive correlation with the conscientiousness reflected by the attributes of Vrat, Moho, Brahmacharya, and Vigyan, Updharan, Shakti, Sampan, it aligns well with the facets like dutifulness and self-discipline. Asar Prakriti type showed positive correlation with neuroticism, which indicates emotional instability. It aligns well with the aggressive traits of Asar Prakriti like Chandam and Anukrosham. Rakshas Prakriti, it showed negative correlation with conscientiousness, which is reflected well by the attributes of Swapna Ayas Bahulam, that is interpreted as disorganization in terms of extremes of physical activity and inactivity. Then slight negative correlation with agreeableness is highlighted well by the traits of Krur and Chhidra Praharanam. Then in Pasha Prakriti, we saw negative correlation with conscientiousness that mirrors well with the Nirakarishnam's trait of this Prakriti. It's interpreted as devoid of decorum and presentable appearance, while a positive correlation with neuroticism suggested emotional instability, which is seen in the impulsive behaviors like Maitan Param, that is excessive and unrestrained sexual desires and activities. Then when we analyze the results of MPAT and GHQ12, it was seen that there was a weaker positive correlation between Rajas and Tamas types. It's due to their association with passion and attachment as shown by the traits of Rag and Trishna in this quotation by Bhagavad Gita. And similarly for Tamas, we can justify it by the presence of attributes of Moho. And Sattva, due to its tendency of illumination, pleasure, lightness, it reflected weaker negative correlations with GHQ12. So this study provides evidence-based correlations, the foundation of evidence-based correlations between Manas Prakriti types and Big Five personality traits, which compares Ayurveda psychology with contemporary psychometrics, and Sattva types aligning well with emotional stability and conscientiousness, supported well the traditional Ayurvedic descriptions of wisdom and self-control. Rajasic Tamasic types, they reflect impulsiveness and emotional volatility, which correlates with higher neuroticism scores and lower conscientiousness, and the findings, they validate linking Vedic concepts to the contemporary scientific frameworks, thereby bridging the cultural and scientific models of personality. Thank you so much.
Thank you, Dr. Swati. Next we have Dr. Ekta Tanwar.
Good afternoon, everyone. My name is Ekta Tanwa. I'm a PhD scholar at Manavashna International Institute of Research and Studies. The topic of my research is the effect of finger millet diet on mental health and metacognitive skills in athletes and non-athletes. It is a randomized controlled trial. Mental health issues are highly prevalent among non-athletes as well as athletes due to the physiological, psychological, and environmental stresses. Finger millet, especially all the millets, are highly nutritious but are traditional foods that are very much undervalued and have not been able to make their way to our plates. Finger millet is one of them, which is highly nutritious, rich in antioxidants, polyphenols, magnesium, calcium, and potassium, and still it is not being consumed widely among the population. This study aims to see the effect of finger millet diet on mental health and cognitive skills of athletes and non-athletes. This is the first such study to study the effect of millet on mental health, especially on the athletic population. And for this study, this is a randomized controlled trial and convenient purposes sampling was used. In this study, after the screening of participants and based on inclusion and exclusion criteria, 30 athletes and 30 non-athletes were finalized, which were further divided into experimental and control group. For the baseline data collection, the mental health and metacognitive skill data was extracted through questionnaires. For the athletes, SMHET, which is a latestly released questionnaire to assess the mental health status of athletes, was used. And for the metacognitive skills, MCSS questionnaire was used. For the non-athletes, MHI 38, PSQI, ESS, and E26 questionnaire was used to evaluate the same parameters which are being assessed by SMHET, and MCSS were used for cognitive skills analysis. After the baseline data collection, the experimental group was provided with finger millet diet for 60 days, in which 1/3 of their daily cereal intake was replaced with finger millet diet, and which was continually provided for 60 days for 2 months. And after the supplementation period, the end-line data was again collected based on the similar patterns of questionnaires. SPSS version 28.0 was used for the statistical analysis, and the results showed that in experimental group of athletes, finger millet diet significantly improved sleep quality, and trends towards anxiety and depression improving was also observed. In non-athletes, it was observed that the mental health status of experimental group of non-athletes improved a little bit but not significantly, but in control group athletes, significantly decline in mental health status was observed. So hereby we can see that finger millet supplementation might have had a protective effect against the worsening of mental health condition. In terms of eating and sleeping patterns, the control group of non-athletes showed the worsening of symptoms of sleeping disorders and eating disorders, and the results were beyond the threshold limit. But in experimental group of non-athletes, we observed that the limits were under threshold and reduced a little bit, though not significantly, but still the results were there. So we can say that finger millet supplementation was effective in reducing the eating disorder symptoms and sleeping disturbances among the experimental groups. And in cognitive skills, we observed that in experimental group of athletes, metacognitive skills improved, and in experimental group of non-athletes, though non-significantly, but the results were much higher than the the control group of non-athletes. Hereby, we can suggest that enhancement and maintenance of metacognitive skills was associated with finger millet supplementation in both the group of experimental groups. Hereby, I conclude by saying that finger millet diet was effective in improving and maintaining of eating habits, sleep quality, mental health, and cognitive performance in the subjects. And this is the first such study to analyze the effect of finger millet diet on mental health and metacognitive skills, especially on the athletic population. Though the results were highly significant in terms of athletes, and much more elaborated results can be obtained if we increase the amount of finger millet diet, because in our study we use only 1/3 of finger millet was replaced with the in the total cereal intake. So by increasing the usage of millet, especially finger millet, more than 1/3 of it, and increasing the duration of the study, along with applying some more verified techniques, mental health can be improved. Because this is worth noting that we did not apply any kind of counseling or any kind of mental health improving therapies to get the results. It was merely the effect of millet. So by integrating this approach, by integrating including millets in the diet, and also by integrating verified techniques, increasing the duration of the study, and by increasing the amount of millet in the study, much more comprehensive and much more evaluated results can be obtained. In the end, I would like to thank all the participants, Nutrition Department of Manavashna University, for their support, and for the funding agency, Ministry of Agriculture, for providing the financial support to carry out this research. Thank you so much.
Thank you so much, Dr. Ekta Tanwar. Next, we have Dr. Ruchi Sharma.
Good afternoon everyone. Today I, Dr. Ruchi Sharma, PhD scholar of BHU, going to present on the topic deciphering the role of Manduk Panni, scintilla sciatica and neurological disorders, chromatographic to network enrichment analysis. So we had taken the Manduk Panni drug that is put under the category of the Medhya Rasayan in the Ayurvedic text. It has been used from several years and showing improvement, but there is no such study available which is showing its mechanism involved in its activity. So in this study, as it is put under the Medhya category, means nootropic drug, so we had studied the possible mechanism involved in it. Firstly, we had prepared the hydroalcoholic extracts using the UV sonicator technique and lipolyzer, and done the HRMS by using Q extractive plus machine. And then after finding out the compound list, we had done the network pharmacology using the databases such as binding databases, David, KG, string. There is one picture. This is of PC analysis. We had taken the gene, firstly we had taken the compound list and taken the protein targets. Protein targets are taken from the gene database that is related to the tissues isolated from the aged peoples and healthy young peoples from the lateral lobe of the brain. As we can see from this, red color is showing the genes of control group and red is of the disease. Some genes are common but others are different. This is a gene analysis of the blue. In this figure, the blue color is showing the down regulation and red color is showing the up regulation of that proteins. Then by using the gene ontology databases, we had evaluated the biological process involved in the aging, molecular functions involved in it, and pathways involved in the aging and specifically Alzheimer's disease. So we had, after obtaining the list of the compounds, we had done the filtration on it. By using the review technique, we had isolated the compounds that are known for the neurological protection. Then we had run the network enrichment analysis of it. This is a Venn diagram of it. We can see that there are 2 out of 319 targets that are found in the scintilla sciatica that are responsible for the Alzheimer, out of which 269 are responsible for the Alzheimer. This is a network enrichment diagram of it. We can see the different compounds present in it are interacting with different proteins and showing the activity. The main 4 that are found in it are synapses. Synapses are responsible for the signal transmission. Secondly, positive regulation of signaling, PI3-AKT signaling pathway, that is also responsible for the neuron generation. Amyloid beta complex, that is responsible in the Alzheimer's disease. So from this we can evaluate that the compounds of the scintilla sciatica are acting on the pathways that are related to the aging disorder and Alzheimer's disease. This is the enrichment pathways analysis of the compound, and we can find that there are many pathways found that are responsible for the neuromodulation and neurological disease. This is the pathway network enrichment diagram, in which we can see that there are many networks found that are responsible for the neurological protection. From this data we can evaluate that compound target enrichment. In this we can see that they are interacting with the interleukin signal, cell receptor immunity, neurodevelopment process, neurotransmission, adaptive immunity. These all are responsible for the neuroprotection. Out of all the compounds, these 4 main compounds are found to be responsible for synapse function, PI3-AKT signaling, calcium channel, and amyloid beta complex. Basically, amyloid breakdowns into APP breakdowns into amyloid, but by alpha cleavage, it forms into the soluble form and get eliminated from the body. But by beta secretase, it converted into the ABP, which is insoluble, and it get accumulated in our brain and causes the Alzheimer disease. As C. asiatica contains the compound that are interacting with this complex, so maybe it will help in removing the amyloid plaques, or do not cleavage it to the form that is accumulated in our brain. Conclusion. So from the network pharmacology study, we can find out the possible mechanism involved in the compounds of the Shantilka asiatica that are responsible for the neuroprotective and specifically nootropic activity. And also we had found that there are many pathways we had found that are also involved in many other diseases like schizophrenia, depression. So we can also use this drug in many other diseases. Thank you. I want to acknowledge faculty of BHU and my supervisor Dr. Rohit Sharma sir and Subhadeep Banerjee sir for helping me in this study. Thank you.
Thank you, Dr. Ruchi. Next we have Dr. Trisha. Dr. Trisha. Moving ahead. Next we have Dr. Nikita Sharma. Dr. Nikita Sharma. Now moving ahead. Thank you, dear participants, for your nice presentations. Now let's take a moment to watch a video prepared by Dr. Pravit sir, chairperson of this session, who could not join us online. Team, please play the video. Thank you. Now I would like to request Professor Dr. S.K. Khandel sir for your concluding remarks on this session.
Thank you, the organizers. I am very sorry we became a bit late to start this session, and unfortunately we could not hear the details from Pravit and my co-chair, and I am very much grateful to Dr. Sevirama, who was presented here from Nimhans, and Antonio Morondi. He was my good friend, and we were working together for many years, and I am very much happy that prevalence of mental disorders is drastically increased, but fortunately this need of time, we are integrating the holistic approach to combat with the mental health disorders. There are very common concepts between the modern conservative medicine and our Ayurvedic medicine, but still I think we are having a treasure of many more concepts which are not being practiced, not being even enlightened. So this is not my turn to say about the mental health, and I am having many opportunities to say about the mental health in this institute. Particularly many times I come here with many of different causes, but NIMHANS has very good institute and a very apex institute, INI, International Excellence Institute of Excellence, who has started this MD Manas Yoga under the Ayurvedic umbrella and Ayurvedic faculty and modern faculty with neurosciences. The mental health, you know, mind and brain. And brain is a machine and mind is operator. But manas sarir is very much different with the man and mind and brain. You know, manas sarir has been written by the Charaka in 4 chapters actually. You know, Sarir Sthan, 4 chapters. One is done in Indriyo Pakramaniya, one is done in Tistre Shraniya, then in Madhumurcha Sanya, then in Unmad, Apashmar and Atattva Vinivesh. So we are feeling that our literature is very concise, but this is not right. Our literature is so broad, but that is in coded language. We have to have some decoding effects. We have to have seek our teacher's help, our clinician's help to decode this language. Otherwise, we are having much more to contribute the modern world in the especially in the psychiatry, because the psychiatry is the most undeveloped or underdeveloped science in modern world. And the prevalence is, you know, the 25% of the people are having this time of the problems. And after COVID, the prevalence drastically raised, and still many of the psychiatric conditions are not even treatable, and many of the conditions the patients could not resume the society for their normal work. Patient even could not able to resume the own house. They are segregated. They are found in roads actually, even in our country and many more countries who has very poor some medical facilities. So we are having this opportunity to join hands with the modern medicine or conventional medicine to contribute our concept into the practice. Okay, and some time I will give you my own thoughts about what we are doing. Better to do than the saying. Okay, then this is the high time. I am thankful to all my young budding scholars who has presented here very well, and some graduates, undergraduates are presented the papers, and they have the courage to present at this stage of All India Institute. I am very praised for that, for them, and all the students were well prepared, and they have given very good numbers, and be assured we will combat very successful this event, this mental disorders in very short time with the help of many of you, and you please do try to understand the basic Ayurveda concepts for the practice and start the practice. Thank you very much. Thank you.
Thank you so much, sir. I would like to extend my heartfelt gratitude to all the presenters for their brainstorming presentation. Now we would like to request Dr. Vivek Agarwal, sir, coordinator and moderator, to felicitate our chairperson, Dr. S.K. Khandel, sir. give a huge round of applause. Now we would like to request our chairperson Dr. S.K. Khandel sir to felicitate our moderator Dr. Ramakant Yadav sir and Dr. Ashutosh Yadav sir. Please give a huge round of applause. Sir, kindly felicitate our coordinator for this session, Dr. Sandeep Tiwari sir. We would now like to request Khandel sir to felicitate moderator Dr. Ramakant Yadav sir. Sir, kindly felicitate our rapporteur for this session, Dr. Shekhar VK sir. The participants are requested to collect their certificates. I would like to invite Dr. Khushi Tyagi, first presenter, to collect her certificate. Please come, Khushi Tyagi. Dr. Khushi Tyagi. Dr. Anagha Sivanandan. Dr. Sonam. Please give a huge round of applause. Dr. Sonam. Dr. Swangil Srivastav. Dr. Swangil Srivastav. Dr. Shatabdi Pati. Dr. Swati. Dr. Ekta Tanwar. Dr. Swati Verma. Please give a huge round of applause for her. Dr. Ekta Tanwar. Dr. Ruchi Sharma. Now, I would like to request Dr. Ramakant Yadav sir to propose vote of thanks. Over to you, sir.
Respected chairperson and distinguished guest for this session. As we are already late, I formally propose my vote of thanks to all, especially to Professor Khandel sir for sparing his valuable time and blessing us for this session, and our guest from Italy and Nimhans, Hyderabad. We are grateful to him for their presentations as a speaker, and above all, I am thankful to all the participants, especially from different parts of India, and especially I am thankful to the UG scholars, because PG and PhD also get their exposure at this highest level, but UG scholars are really admirable, and I hope that they will continue their intensity in the future also. With this, once again, I congratulate all and thank you all. Thank you very much.